cause inflammation, mainly acute inflammation, and the toxins, different toxins that can enter into our body may trigger inflammation and traumatism. Traumatism may refer to, I think this you have covered in inflammation. There are factors of or the causes of injury or inflammation. I have seen some. There are physical agents such as traumatism, such as high temperature or very low temperature. We have infections, bacterial, parasitic, viral, and so on. We have chemicals here, so the toxin here it stands for chemicals and so on. So then in inflammation, as I said, there are these three agents: chemical events, cellular events, and vascular events or changes. So you see that this is a capillary bed where we have arteriolar end here. Here it is red, and a bluish end. It is a venular end here. So you see that there are neutrophils. These cells, of course, it is a diagram. The cells don't look like this. So these are neutrophils which are here. They should not be at this high number as they are here. So what are the consequences then of the inflammation? It is what I was saying. There is either progression towards chronic inflammation here. And in some cases, the first injury will automatically induce a chronic inflammation without passing through acute inflammation. So you have examples here. So there is an inflammation which always starts as chronic, which doesn't start with acute then chronic. So here, for example, we have a tuberculosis. You cannot say someone is having an acute inflammation because of tuberculosis. No, it is always chronic. And the same for these fungal infections. It is always chronic. So viral infections, they are classified as being in chronic inflammation, as causing chronic inflammation because, as I said, they are associated with an increase in lymphocytes. So that's why. But they have cardinal signs of acute inflammation. So I think everybody has had the rhinitis caused by viruses, so grippe or flu, as we call it in English, COVID, and so on. So they start as the acute inflammation. Then they can progress. But because of the cellular events which happen in viral infection, so they are usually classified as straightforward chronic inflammatory agents. So these are what we see in chronic inflammation. So apart from progression to the chronic inflammation, we can have a healing from directly acute inflammation or acute inflammation to chronic inflammation, then to fibrosis. So which we will discuss in much more details after. There can be an abscess formation. So abscess, it means there's a collection of pus. So pus is composed of what? There are inflammatory cells, there are dead tissue debris, and there are bacteria, because usually pus is caused by a bacterial infection, but also sometimes a parasitic inflammation and the fungal infection, but usually not viral infections. Or there can be resorption, as I said here, where there is clearance of injurious stimuli, clearance of mediators of inflammatory cells, replacement of injured cells, and the normal function of that tissue is restored. So if you are asked, what are the possible outcomes of inflammation? So you can see clearly them here: resorption, fibrosis, or towards a chronic inflammation. So these are the three main possible outcomes of any acute inflammation. And you see that chronic inflammation, its effect can be only either usually it is fibrosis, because it can be by resorption. It cannot be by resorption. So the only possible outcome is fibrosis, But as a medical doctor, you can intervene and make sure this fibrosis is not too much. And in that case, there will be a kind of resorption, but which is not automatic, but it was caused by the treatment. But usually chronic inflammation will end up with fibrosis. So the inflammatory response is closely intertwined with the process of repair. I think you have seen this, and if you read that book in that chapter, they say that as soon as the inflammation starts, also the healing process starts. So the body starts not only to fight, but also to clear things which are injurious to the body, to that body. So inflammation, you have seen its functions. It is to dilute, to destroy, and to isolate the injurious agent. So to dilute, how dilute? You understand that there will be a fluid. So that's why there is exudation, transudation, the exudation. That fluid which goes where there is inflammation, that fluid, it causes, of course, the swelling, but another function of it is to dilute the injurious agent. If it was a toxin, if there were bacteria, so when they are diluted, you understand that their action will be somehow decreased. So it is like a chemical. If a chemical, there is a spills of an acid. If the acid is too much concentrated, then the damage will be higher than if that acid is diluted. To destroy, if the bacteria, they will be destroyed by the inflammation, especially inflammatory cells, or isolate. So isolate mainly here, it refers to things like abscess. Abscess, the body creates a kind of capsule which limits the spread of the inflammation. So the bacteria, the dead tissue debris, they will be kept inside a kind of a capsule. So in that case, the body tries to isolate that injured area from other areas so that no other areas may be affected. But also, isolation here can refer to things like when, for example, you have a wound on a leg, or if it is injured, let's say burnt, so there is a tendency not to use that part. And this is explained by the fifth cardinal sign of loss of function. So when there is a loss of function, also it helps the blood in that area to be slow, the blood flow. So in that case, the body can control the spread of the injurious agent. So it will be easier for the body to limit the spread of the injurious agent. So the inflammation dilutes, destroys, and isolates the injurious agent and consequent debris and initiate the tissue repair. So this is very important. Whenever there is inflammation, there is initiation of repair, but not in all cases. It depends on many factors, as we shall see, including the immunity of someone. So if someone has no strong immunity, like HIV patient, diabetic patients, the healing will be very slow or not happen. So I know many patients who had diabetes. So he gets a wound on a toe or at the foot. The wound will not heal. Sometimes they amputate. You amputate, when you amputate, of course, in surgery, it means you create another wound. That wound also doesn't repair. So it becomes, the area becomes necrotic. Then you go on, you do another amputation. Again, no healing, but there is again necrosis. So you do another amputation. So until someone who had yari afite nk'igisebe kwino cyanze gukira bakabona cyane necrotic, then ukazabona ukuguru kose baraguciye bayenda baca gato gato. Why? Because the healing doesn't happen. So immunity of someone is very important. So repair begins during the early phases of inflammation, but reaches completion usually after the injurious influence has been neutralized. So when the injurious agent has not been neutralized, you cannot say healing will take place. So there's the things they explain, or for example, if you do surgery, then you leave something inside. When ugasigamo urudodo rudashonga kuko iyo ari mu nda dukoresha indodo zishonga. So when you leave there a stick which is permanent, then it will create a chronic inflammation. There is nothing you can do to stop that except to reopen and remove that thing. So maybe you have seen in the newspapers, people saying the doctors, they have operated on me, then they have left these gauzes, biriya bitambaro hanaguza mu nda cyangwa hano si kubaga babitaye mu nda. Yes, when they are left there, they will create a kind of chronic inflammation. Me personally, people used to say they left these tissues inside my abdomen, and then it was after maybe 3 or 4 years that this was discovered. So I used to say they are lying, but I have seen it personally. People, they have done a surgery, then they brought a big specimen. They said we have seen a very big tumor inside the abdominal cavity. But that patient was not from Rwanda, from a neighboring country. So we received that specimen at Seashika. Said it is a very big tumor. So it was like 3 kilograms, very big. So, but when we cut, we found that the namagoze yari yuzuyemo gusa. Icyari ikigoze kinini ntabwo yari menshi, cyari kinini cyane bibagiriwe mu nda. So it happens. So umubiri cyo wakoze aho ni ukurwana nacyo, uhita ucyambika capsule, so it became like a tumor. So cya gitambaro giheramo imbere. So we only of course on the microscope it was not much needed because we had seen the reason, but we did also histology. We found giant cell types of inflammation. So when there is a certain injurious agent or stimulus which the body cannot destroy, like sticks, ziranshinge, usizemo akuma, usizemo icyo gitambaro, so the body cannot destroy it because it is not a biological agent. Ntabwo ari bacteria cyangwa parasite. So the body, what it does, it is to, the macrophages, they fuse themselves. Many macrophages, they fuse their cytoplasms, then they become one cell but with multiple nuclei. So that's why it is called the multi-nucleated giant cell. So there's the ones, there are of many types. There are those of giant cells, we know how they appear. There are those, those of foreign body, fighting against a foreign body. There are those which are known to contain bacteria such as the bacteria of tuberculosis, because also the body cannot destroy it itself. So we know how the cells appear. So going to tissue repair itself. So injury to cells and tissues set in motion a series of events that contain the damage and initiate the healing. It is what we are saying. So there are 5 processes. There is hemostasis, there is inflammation, there is regeneration, fibrosis, and remodeling. So hemostasis, this word you have seen it in the tissue. Okay, in the tissue, in the cell injury, you have seen what you call homeostasis, not hemostasis. Homeostasis, it means the mechanisms by which the body keeps the balance. Balance, for example, balance between the growth of cells and the non-growth of cells. So meaning that in our body, we have factors which tell our cells to grow or to multiply themselves. And there are other factors which say no. These we call them inhibitory factors. So we have stimulatory factors, which just we used to say growth factors, and you have inhibitory factors. So for our body to be normal, then we need a balance between both. So this is what is called homeostasis. But the hemostasis here, it refers to the mechanism by which the body stops bleeding or stops hemorrhage. So when there is a injury, usually there is a bleeding. It can be macroscopic, meaning you can see it by the eyes, or it can be microscopic, whereby you can see only in the microscope that there are cells which escaped from the blood vessel lumen. So then in hearing, we have hemostasis, meaning to stop hemorrhage or bleeding. We have inflammation, which of course it is still ongoing. We have a regeneration. So we'll see what is regeneration, and the fibrosis and the remodeling. This remodeling is very important because to have a repair of an injured area, it is one thing, meaning to deposit, for example, fibers to make a scar. But this scar must be strong in order to support the area. To be strong, then we need the remodeling. But also remodeling is important to limit the overhealing, meaning large scars. So remodeling is very important, as we shall see. So the healing process, they have a series of events. So regeneration, I think here we have the three main ones we must understand: regeneration, repair, and fibrosis. So regeneration, it just means there is a complete restitution of lost or damaged tissue. So it means that here the cells which have been killed, they will be replaced by other cells, but of the same type. So here we say there is regeneration. So we shall see some example. But here they say this happens only if the tissues have a high proliferative capacity. So which cells have a high proliferative capacity? You know, hematopoietic cells, because our body continues to make new blood vessels, new blood cells. So this is hematopoiesis, as you have seen in hematology, or we see it. So it means that there are stem cells which produce new red blood vessels, new white blood vessels, new red blood cells, and new white blood cells, new platelets, and so on. The skin also, it degenerates, and the gastrointestinal epithelium also, all these tissues, they can regenerate. And maybe for your information, you know that neurons, they cannot multiply. So no cell division in the neurons. So meaning that if a neuron is lost, it will be, that space will be replaced by where it was, there will be just fibers which will be deposited. So meaning that the central nervous system, the healing there cannot be by regeneration, it can be by fibrosis. So repair, there is a combination of regeneration and scar formation by collagen deposition. So it means, for example, epithelial cells, they are regenerated, but the underlying connective tissue, let's say if it was in the dermis, if there are cells which have been damaged, they will not be replaced by the same types of cells, but there will be collagen deposition. So ugasanga no hari nka fatty cells, adipocytes, hajemo fibers. So but on the epidermis was restored. So in this case, we'll say there has been a regeneration of the epithelium, but the underlying dermis was not regenerated, but there has been a scar formation inside. So combination of both will be a repair. So fibrosis is when there is only collagen deposition or deposits and no re-epithelialization. So that is in general the difference between the three terms. So this is a diagram just explaining the same. So we have a tissue. This is just a representation for a certain type of a tissue. Then there is an injury. After injury, there can be a regeneration. If the tissue which was injured, it can regenerate, can renew itself. So this can happen in epidermis because in epidermis you have cells which are always changing. You have a gastrointestinal tract epithelium and you have a hematopoietic system, as I said. So there is another kind of regeneration, but which is not a true regeneration in stable tissues. I think in cell injury and adaptation, you saw this. We have three kinds of tissues. We have renewing tissues, which are called the labile tissues. We have stable tissues. So these are tissues which normally don't multiply, but under certain circumstances, they can be stimulated and make new cells. So these are what called stable cells. Then we have others which are called permanent, meaning that when they die, they are not replaced by the same kind of cells, but they'll be replaced by fibrosis. So I gave an example of the neurons. So in stable tissues, there will be a compensatory growth of, for example, liver and kidney. So how do you know this happens? When there is a patient, for example, with a liver cancer, for example, the cancer was in one lobe, because you know the liver has two lobes. So it was in the left lobe. Then they removed that lobe completely to cure that tumor. So what is seen is that after months or years, the remaining lobe will grow and compensate the size which was lost. Of course, there will be no additional lobe. It will be just one lobe which will grow to compensate the size of the lobe which was removed. The same for kidney. Here in Rwanda, we have many children with tumors, with a tumor affecting the kidney, which is called nephroblastoma or Williams tumor. So when there is a Williams tumor, automatically they remove that kidney. So the remaining kidney usually will have to assume all the responsibilities that were carried out by the kidney which was lost. So to do so, its size must increase. And I know even some children with diagnosed with that cancer in both kidneys. So because nobody can stay alive if they don't have a kidney. So what doctors did, they removed the completely one kidney, which was completely infiltrated by the tumor. And for the other kidney, which was partially affected, they removed the part which was affected. Then that child remained with half a kidney. So that half kidney had to grow to compensate the one which was lost. So this is to explain compensatory growth of liver and kidney. This is mainly where this happens. So then we can be, if there is a wound, for example, here, this is a tissue, then part of it was severely injured tissues. Cells here have died, so they will be replaced by fibers. So this will be wound healing by scar formation. So one part, only one section of it. And in cases whereby it is not a wound, meaning a wound is limited to just to a site. But chronic inflammation, if it affects, for example, the whole liver, you cannot say it is a wound, it affected maybe one part of the liver. When there is hepatitis, it affects the whole liver. If that inflammation becomes chronic, the healing will be by fibrosis, and the whole organ will be fibrosed. And when it is liver nephropathy fibrosis, cirrhosis. So cirrhosis means fibrosis of the liver. So other organs also, they can have fibrosis. So we see them every day. But the term cirrhosis is specifically used for the liver. So the relative contributions of repair and regeneration are influenced by many things. So the proliferative capacity of the cells, so these are very important for you to understand, because you are medical doctors or dental surgeons who are also doctors. So you will always have to know the science behind everything you do. So if you are doing a surgery on a skin, you keep in mind that there is a regenerative tissue, epidermis. So what can I do to make sure it will regenerate? Because God has given it that capacity. And when you are operating, for those who do neurosurgery, if you are operating on the brain, you know In the brain, there can be no regeneration, but fibrosis. So what can I do to limit the fibrosis? Because as you do surgery, you create an injury, therapeutic injury. It is needed, but also it has consequences. So how can I do to make sure the scar which will come afterwards will be as little as possible? So for you as a doctor, then you will have to understand, to know for each type of cell, of tissue or organ, how can I go in order to achieve a good outcome. So therefore, it is why you will have to know the capacity of the cells of that tissue. Is it a permanent tissue? Is it a labile tissue? Is it a stable tissue? So the integrity of the extracellular matrix, we shall see that regeneration, for example, in liver, if there is an injury and the injury affects the T structure apart from the hepatocyte, usually the healing will not be by regeneration. It will be by fibrosis. So you must make sure the extracellular matrix is kept as intact as possible. So the resolution or the chronicity of the injury and inflammation, these are factors also. So when you do surgery, make sure you leave nothing inside, you leave no dead tissue, because it will create a perpetual inflammation. And with perpetual inflammation, no healing. Another thing you must understand is that in embryology, of course, you know, we have this blastocyst from which we have endoderm, mesoderm, and the ectoderm layers. From them, we have cells. And these, in these three layers, the cells which are there can differentiate to any type of tissue in their career, if I can say so. So meaning that in the endoderm, the cells which are there can differentiate to give rise to gastrointestinal tract, to liver, and so on. But when a cell has become hepatocyte, it cannot differentiate to give rise to intestinal cells. It is no longer possible. So meaning that we have what we call like stem cells or undifferentiated cells. So stem cells written here. So these are undifferentiated cells which can differentiate into any type of cells depending on the needs, on the stimulation which comes to them. So then, for example, here we have a baseline cell population. So usually these cells, they differentiate. For example, here we have certified squamous epithelium. Or they can continue to proliferate. And this is dangerous, of course. When cells proliferate being not differentiated, this is how cancers develop. Cancers, they are just poorly differentiated cells which proliferate. Or they can die. So most of them, they die. And this is by apoptosis. You have seen death by apoptosis, which is a programmed cell death, or by necrosis, which is a pathological. So apoptosis is usually physiological, though sometimes can be pathological. So stem cells, then, they are the ones giving rise to this baseline cell population. So these stem cells, why are they coming here in healing? It is because through research, it was recently seen that though we are adult persons, we still have some stem cells kept in some areas of our body. So these stem cells, they will help to give rise to new cells when we lose some cells. But for these stem cells to differentiate, for example, into epithelium, they must be stimulated by some specific factors. So this is, of course, not explored in medicine because it is very difficult. So if someone, for example, loses a kidney, there is no way you can say, I can just locate where there is a cell which I can stimulate and produce a new kidney. not yet done. But at least it is known that these cells they exist. And this is why sometimes it is thought that even in the brain, if someone loses neurons, we have seen they are not replaced. There's the stem cells which are there can produce new neurons under stimulation. These are experiments that they do in labs, in laboratory animals, but in humans not yet. So cell proliferation can be stimulated by physiologic or pathologic conditions. So physiologic, for example, during the menstrual cycle in women, in ladies. So there is a time the endometrium grows, so it becomes very thick because it is stimulated by estrogen. And at a certain time, estrogen will decrease, progesterone will be higher. When it goes higher, then things become opposite. The endometrium will shrink and so on. So nodiragoita, this is not physiological, it is pathological. It is overgrowth of the thyroid because there is a lack of certain hormones. So this is the summary of the three groups of cells I was saying. Labile cells, these are continually dividing and they can replace the dying cells. Quiescent or stable cells, they have a low level of replication. They can replicate if need is there. So here we have an example for the liver and the kidney. Here we can have healing by regeneration, mainly by compensation. So the cells will multiply and therefore the size of the organ will be increased to compensate the part which was lost. But this multiplication of cells happens only when there is a problem. Otherwise, these cells, they are just quiescent. They don't do multiplication. Non-mitotic or permanent cells which cannot divide. So here I give an example of the neurons. So the examples are given here. So hepatocyte, tubular, renal tubular epithelium, and the pancreas. Then you have a neurons, striated muscle, and the cardiac muscles. Also, they are considered permanent tissues. So, meaning that when you are dealing with these tissues, you have to handle them accordingly. So stem cells, I think I explained them, they have a capacity to generate differentiated cell lineages. So they have self-renewal properties. Self-renewal means what? One stem cell, what it will do, it is to produce a second cell, a daughter cell by multiplication. Then one of these two cells will continue the differentiation, give rise maybe to a epithelial cell or a hepatocyte. The remaining one will be kept there as a stem cell so that it can intervene again in the future if needed. So we have embryonic stem cells, which are totipotent. These are what I was explaining in the endoderm, mesoderm, and the ectoderm. So, and the adult stem cells or somatic stem cells, they are just inside the body, anywhere, in any organ. And this will help you to understand when we reach the systemic pathology that there are tumors. We see them almost every day. We see tumors, for example, of the ovary. Wafungura ugasanga harimo amenyo, ugasanga harimo skin and its appendages and so on, thyroid. Why? Because in the ovary we have these kinds of adult stem cells which can be stimulated and differentiates when someone is an adult and produce the cells which
Lecturer, you're muted.
Oh, sorry, I don't know how it happens.
They are not hearing you.
Can you hear me now?
Yes, we can.
Yeah, so it was entered. I don't know how it happened. So I was explaining why from these adult stem cells, which are anywhere in our body, people, they develop tumors. For example, someone develop a tumor in the ovary or scrotum or in the brain, and when you do histology, you find tissues which are not proper in that area. So in the ovary or in the desert teratomas, we used to see skin, we see tooth, and so on. So because the desert cells, they have been kept there, but if they have had an opportunity to differentiate during embryogenesis, they could have given rise to desert tissues, to tooth, to brain, to skin, and so on, or thyroid. But these, we see them in the ovary, and these are very frequent cases we see almost every day. So the diagram just to explain stem cell generation and the differentiation. So zygote, blastocyst, then we have in the blastocyst we have there's 3 layers. We have pluripotent stem cells. If they are cultured in laboratories, for those who will go into research field, so say you will run a cell culture. So when you culture the cells, so culture means just guhinga, how can you call them? So it means you take the cells, you put them in a medium which is appropriate for them, but you add stimuli for them to continue to be alive. So when then you stimulate them, some of them, they will differentiate into hepatocyte, neurons, cardiomyocyte, and so on. So then, so otherwise, these pluripotent cells, they differentiate into multipotent, then lineage committed stem cells. I think this you understand more because of hematology in hematopoiesis. Then we have differentiated cells, some from endoderm, for example, gastrointestinal tract, from mesoderm, for example, muscle, adipose tissue, bones, and so on. And the ectoderm derived here, we have skin and the brain. So then we have stem cell initiates in various tissues. I think this is what I was explaining, which can differentiate at any time to give rise to any type of tissue. So the cell cycle also is very important to understand, because this will help to understand most of the concepts here in hearing, but also when we learn about the cancers, tumors, how tumors develop. So this is very important. Cell cycle, what happens, cell signaling, things you have learned in molecular biology are very important. So the cell cycle consists of GO phase, G1. So GO means the cells are just resting. So we have G1. G just refers to growth, phase 1. And the S refers to synthesis, DNA synthesis. And then G2 is growth, phase 2. And then mitosis phase, in which we have 4 stages: prophase, metaphase, anaphase, and then telophase. And this fifth, cytokinesis, meaning the cells which have been made, they separate themselves from each other. So the same way is shown here. So we have a quiescent cell here, but after mitosis, then we have 2 cells. These 2 cells, they go straightforward into GO phase, but in some tissues, they go straight forward into G1 phase. So ahangaha rero niho hareba, hari selile zihita zijya muri GO phase kandi zidashobora kuzayivamo nayo. These are permanent cells, like neurons, striated muscle, or skeletal and the cardiac muscle. And we have cells which are they are in GO phase, but which can be stimulated to come back and enter into G1 phase. These are the stable or quiescent cells, as you have seen, liver, pancreas, and the kidney. And there are cells which never go into GO phase. So after M phase, they go straight forward to G1 phase. These are labile cells, epithelial cells of GIT and the skin. So that is their main difference. So I think it is what I was explaining, and you know that there are checkpoints before a cell goes from one phase to another phase. And these checkpoints are very important. We shall see it in a tumor when we learn about the tumors, because, for example, here there is a gene which is responsible to make sure there is a check. So when that gene, which is responsible for checking, is itself having problems, then you understand no check will be carried out. Then a cell which have a problem, a cancer cell, will be allowed to multiply. So it is like if you have someone responsible for checking the security of somewhere, then he's corrupt. Then if he's corrupt, then the enemies can pass through very easily and make damage. So there are growth factors which help us, which stimulates our cells to grow to replace those which were lost. So in pathology, when we say cell growth, usually it means the multiplication of cell. A cell giving rise to daughter cells. So don't understand is just for growing in size. If we are talking about a single cell. For tissue, yes, it grows in size, but cells, when we say growth, usually it refers to the multiplication of them. So we have the growth factors, GFS growth factors. So we have epidermal growth factor. You can understand it stimulates epidermal cells to multiply. You understand this is important if you have to acquire a healing of a wound on the skin. You have a transforming growth factor. They are of two kinds, alpha and beta. And here, interestingly, they are antagonists. Icho alpha ikora beta irachirwana. So they control each other. So imwe iri muri opposition iyindi. So and first there is a resultant homeostasis. There is a hepatocyte growth factor. You understand it will stimulate hepatocytes to produce new ones. For example, when some are lost. Vascular and endothelial growth factor, they stimulate new blood vessel formation. Platelet-derived growth factor, here they don't stimulate platelet, but they are derived from platelet. These also are very important in making new blood vessels. We have fibroblast growth factors. They stimulate the fibroblasts to produce fibers, collagen fibers. Collagen is produced by fibroblasts. Then, with that, there will be fibrosis. Keratinocytes, so they stimulate these the superficial squamous cells of the epidermis mainly. We have also cytokines. So for those who have done Latin and so on, you see cyto means cell, kine movement. So these are the chemicals which help our cells to move, or they induce them to move. Going back to inflammation, we have seen that the cells, they will leave the lumen of the vessel and they go to fight where there is an injury. So to go, they will be stimulated by these cytokines or molecules which trigger the movement of cells. So here we have a tumor necrosis factor, we have interleukin-1, and we have interferons. So interleukin, you know, there are many, I think there are more than 20. We have interleukin-1, 2, and so on. So personally, I have been using interleukin-2 in research for because it helps the lymphocytes to produce a new lymphocyte. So we are using it just for research to try to make molecules which can help the body to boost the immunity in cases of leukemia, of cancer. So interferons, we have many interferons alpha, interferons beta, interferons gamma, and interferons lambda. So alpha and beta, they are used zakoreshwa cyane cyane so they are used therapeutically, meaning that barazifata bakazigira nyinshi zakoreshwaga mu kuvura umwijima, hepatitis and so on, but still they are used. Interferon gamma is very also important in many things, even in cancers and so on. And the interferon lambda, which is discovered very, very recently, I think in 2003, it is when the interferon lambdas were discovered. So in your old books, you cannot see. So I have been done one research on interferon lambda 4. In Rwandan children, how it influences them to clear very easily the inflammation without getting treatment for bacteria or viral infections. So we have here a list of growth factors, abbreviations of them. We have the source, meaning where they are produced, and their functions. Of course, these are things to know, especially that as medical doctors, you don't just to treat patients have a full name, so you have always to know the science behind. So, for example, epithelial growth factor alpha is abbreviated EGF. It's produced by platelet, macrophage, saliva, urine, milk, and plasma, and its function, it is to cause mitogenic for keratinocyte, meaning that it induces mitosis for these cells. Also, it produces keratinocyte migration and granulation tissue formation, and so on. So each one has this. So you have seen also some mediators of inflammation. You know that for them also you have to know their source and their function. So, for example, if you are asked, serotonin is produced by what? What is its function? Does it cause vasodilation or vasoconstriction? Does it cause increased vascular permeability or not? And so on. It is important because as you treat your patient, you must know which drug must I use. So, for example, the patient will come with arimuri shock. So patient in shock means the blood is no longer saturating or it is going very slow. The consequence is that many tissues will not have enough oxygen. So what can I do? What is the drug I can use to reduce the caliber of the vessels? Because in shock, usually we have the blood vessels, they are extensively dilated. So you must think in your mind that if I have something which can reduce the caliber of the vessels, then maybe the blood flow will be restored. So that's how people, they came up with giving drugs which are against histamine or against serotonin. So noradrenaline or adrenaline is a drug known to cause vasoconstriction. So you give it because you know it causes vasoconstriction, meaning decreases the caliber of the vessel, and therefore you are limiting or at least reverting the vasodilation which has caused the shock. So just you don't have to do things because you have seen someone doing it. You must doing it knowing the science behind. So apart from growth factors, as I said, homeostasis, we have inhibitors. So inhibitors in tissue healing and repair, there are not many. So we have antagonistic growth factor. So transforming growth factor beta and the alpha, they are antagonistic. What one does, the other one says no. So they will have suppressor genes. I think this time we will understand it better when we go to tumors. But suppressor genes, it means there are genes which say, no, we don't want these cells to continue to produce new ones. so suppressing. So you have a P53, which is very much known. The retinoblastoma gene 1, this is a gene which was known to be involved when it has a problem. The person will develop a cancer of the eye in the retina. We have Williams tumor 1 gene. This is a gene, when it is mutated, it causes the cancers such as Williams tumor or nephroblastoma affecting the kidney, I had mentioned before. So there's a suppressor genes, they promote cellular differentiation, and in doing so, in so doing, also they inhibit cellular autonomy and the tumor development. So this is why they are called tumor suppressor genes. So no kuvuga ngaha no muri kanseri iyo ubonye umuti ushobora gutuma ya maseri yagize kanseri aba differentiated akaba nk'amaserire nomu, uwo muti uba ari mwiza. So nicyo n'aya majene akora, ni ugutuma amaserire areka kuba nka stem cells akaba differentiated, because if cells they proliferate in their undifferentiated status, it will be a cancer. But when you cause them to differentiate, though they can proliferate, they will cause a tumor, but which is not a cancer. So these are very important. You shall see their details in the chapter about neoplasm. So cellular signaling, especially in a cell growth, you know that a cell can be stimulated by the products of itself. So for example, this cell has produced a factor called the X. This factor comes back and it is received at the receptor of the same cells. So this is called autocrine signaling. When a cell is stimulated by factors produced by a neighboring cell, which is not far. For example, here, this cell produces these factors, and these, they will be received by an adjacent cell on its receptors. Then this will be a paracrine signaling. So it is signaling of a cell close to that to the cell which produces this signaling agents. Then endocrine signaling, a cell produces something, and that thing goes very far to stimulate cells in another organ. So endocrine, understand, here we have hormones. So a hormone is produced by the brain, and it goes to stimulate, let's say, ovary, thyroid, and so on. So at a distant target. So I think these are three things to which are easy to understand: autocrine, paracrine, and endocrine. So any questions so far? Do you have any question? Okay, so mechanisms of tissue and organ regeneration. So regeneration is the replacement of lost structure. They are replaced by the same type of tissue structure. I've seen this in a difference to other types of healing, such as repair and fibrosis. And this is dependent on the normal turnover of the original tissue, meaning that if the original tissue can turn over very easily, can have a normal turnover, meaning it can, the cells are in a continual cell cycle, then it is possible to have a replacement. Or if they are quiescent, but they can undergo mitosis and so on, they will be, the replacement, the regeneration will be possible. So can it be differentiated from compensatory growth? So compensatory growth and regeneration, they are different. As you have seen, muri aho twatangiriye, aho twarebaga nka liver, if a lobe is lost, it can be not be replaced by another lobe, but by compensatory overgrowth of the remaining lobe. So regeneration is the only possible under these conditions. There are three. The defect occurs in molting, shed tissue, or stable tissue. Meaning in labile tissues or stable tissues, not in permanent. That is the meaning. The defect must not be in permanent tissue. The second criterion, the damage is limited to organ-specific cells. I think I mentioned this. If the damage happens to the liver and it affects only hepatocytes, because hepatocytes, they are organ-specific cells in the liver. If it is limited there, it is possible to have a regeneration because the hepatocytes will be replaced by other hepatocytes. But if the damage also has affected other structures, sinusoids, and so on, the regeneration will not take place. There will be a fibrosis. The integrity of the epithelial basement membrane and or perivascular connective tissue forming the stromal structure is preserved. So meaning here someone has lost the epithelium, but the basement membrane is intact and the tissues surrounding the vessels are intact. In this case, regeneration is possible. So the consequences of this is what if you do surgery, for example, or then of course the surgery will have somewhere to open the skin in most of the cases, unless it is in the oral cavity, but in the oral cavity also have the epithelium. So make sure when you do incision, you do just as properly as possible. And this is one. And when you are suturing, then you have to make sure a layer is sutured with its counterpart. Ntuzafate ngo muscle uyidode igenda ifatane, let's say, na fibrous tissue. So if you have passed through a muscle, you make sure muscle is sutured to a muscle. Fibrous tissue to its counterpart, fibrous tissue. Epidermis against its counterpart, epidermis. So nufata epidermis ukaidoda ku ruhande rumwe ukaidoda ku rundi ruhande uidode kuri dermis. There cannot be a healing by regeneration. Uzabukere scarring. So, and this is some of the things which differentiate doctors. Abarwayi bati uriya turamuzi n'aba nurses bareka bivuga. Yari umuntu uje ugomba kubaga ati wigire kwa kanaka niwe ubaga neza akakudoda neza ukazagira inkovu nziza ndetse ikagenda. Ariko n'uya kakana adoda nabi uko yishakiye ukazagira igikovu gisa nabi bizarre. So ugasanga abarwayi bahita nk'umuganga umwe kubera akantu nk'ako koroshye kandi washobora kwitaho kagira umumaro umurwayi ariko nawe kagatuma uba umuganga mwiza. So regeneration requires, I think, stem cells or renewal, which are cells for renewal and tissue cells capable of divide and intact scaffold. There's the tissues which are not the organ-specific cell. So here there is an example. We have a liver. You remember its histology. We have a lobule here. We have the triad here, portal triad here. So there has been an injury here. You see that hepatocytes, which are here somehow pink or orange, you see that here there are many hepatocytes which are lost. But the underlying basement membranes, the vessels here, even in the portal triad, they are intact. So therefore here, because the scaffold, this connective tissue, the vessels, and the ducts, they are intact, it is possible to regenerate. So the hepatocytes which survive, they will multiply and replace with those which are lost. Therefore here we can have a regeneration. So this is when it is a small part of the liver which is affected. And the connective tissue was not affected, it is intact. So the extracellular matrix and the cell matrix interactions. So there are many things here in research which are going on how the cells, they interact with the surrounding, let's say, integrins and many other defensins. There are many proteins in the extracellular matrix. the way they interact, it influences the healing, not only in the cases of inflammation, but also in cancer. So people, they try to explore these things in research. So I remember in a research group I was in, there was somebody which was much interested in knowing the interaction between the hematopoietic cells within the bone marrow, the interaction of these cells and the microenvironment, the fibers around there, how it can influence the healing of cancer in the case that someone has a blood cancer, leukemia. So they are being explored. So extracellular matrix is composed of three kinds of molecules. This you have seen in general histology. Fibrous structural proteins such as collagens and the elastins. Adhesive glycoproteins. They connect the matrix elements to one another and from one matrix element to cells. You understand that these are adhesive. They make sure the cells adhere to the surrounding environment. You have a proteoglycans and hyaluronan that provide resilience and lubrication. To make sure in the tissue there is lubrication, it is not dry. And also resilience means aho ushobora kwicara umwanya munini cyangwa ugakoresha amaboko ariko tissues zirimo ntizangirike, because niba uri guhinga ufashe umuhini w'isuka kame hagombye kuba hariho injury on the cells ziri mu biganza, but this doesn't happen because of these things which are in dermis and the underlying structures. So the mechanism by which the extracellular matrix and the growth factors interact, for example, integrins, they bind the extracellular matrix component and interact with the cytoskeleton and focal adhesion complexes. You understand? Cytoskeleton is inside the cytoplasm of a cell. So integrins, they bind these cytoskeletal proteins to the extracellular matrix. So they initiated the production of intracellular messenger. So meaning that messenger means in cell signaling you have seen that when a message comes to a cell, it is received by a receptor. Then that receptor will convey the information to the nucleus, because the nucleus is the government of a cell. The information must go there for the government to take a decision. So how does that information reach the nucleus? It is through the intracellular messengers. So the cell surface receptor for growth factors may activate cell transition pathways that develop with those that overlap with those activated by integrins. So cell surface receptors, I was mentioning them, they are the ones receiving the growth factors or inhibitory factors, which comes with that information for outside. So all these then, they help the cell to grow, multiplication, to have a movement and to differentiate. So here there is a diagram just explaining that this is a cell. It has a nucleus. So in the cytoplasm, you have a cytoskeleton. Here, these fibers here. So we have seen that integrins, they will make sure they anchor the extracellular matrix. For example, we have laminin fibers, we have a collagen. So they anchor them to the intracellular proteins of the cytoskeleton. So in this case, then the cell will be stable there. And if a cell has to move, these integrins, they will allow it to move. Together you add that. So this is just an example of how extracellular matrix and the intracellular matrix, they interact. So therefore, for growth factors, the growth factors, they will be received by the receptor. This is a growth factor here in blue, somehow blue. Then there is a receptor itself. When the message comes, for example, it is a hormone coming from the brain, from the the pituitary gland. It comes here, it is received by this cell. Let's say it is a follicular cell in the thyroid. Then the information brought by the growth factor will be carried out to the nucleus for it to take a decision by cytoplasmic signal transmission pathway or second messenger, and so on. So the healing by repair, scar formation, and the fibrosis, as we have seen. So we have seen healing by regeneration. Here we are talking about repair, scar formation, and the fibrosis. These almost refer to the same things. So when does fibrosis take place in the healing process? So you can understand, it is when regeneration could not take place. What are the factors for regeneration to take place? We have seen the cells must be stable or labile, the scaffold must be kept intact, and so on. So if this doesn't happen, then, or there was a too severe inflammation with necrosis and so on, we cannot have regeneration, we will have a scar. Is repair by deposition of collagen and other extracellular matrix components causing the formation of scar. Many disease appearances anatomically are the result of healing, such as atherosclerosis. So maybe you have not yet had this atherosclerosis. So it is a disease, if you can say so, whereby there is the inflammation inside the intima of a vessel, and that inflammation, that injury will cause inflammation, chronic inflammation. Then aho hantu hazabyimba, nihabyimba huzuremo fat and so on, calcifications, calcium deposit, nibibyimba bitume lumen of the vessel will be occluded. If it is occluded, no blood flow. If no blood flow, the area which could be supplied by that vessel will not receive the blood, therefore it will die. So niho umuntu wabangwa is a stroke iyo bibaye mu bwonko. It is because there is the occlusion of a vessel somewhere, the blood doesn't reach some parts of the brain, then that part dies by necrosis, and then umuntu agasanga yagize paralyze and so on. When it is, sometimes it can be transient, that blood flow cut. So in that case, the restoring of the vascularization takes place. In the heart, this is called the myocardial infarction if the blood doesn't reach a certain part. So, and the main cause of stroke and myocardial infarction is atherosclerosis. But this is a separate chapter itself, so we shall see afterwards. So the repair by connective tissue deposition includes the following basic structures. So these are steps you must understand and you must know. So first of all, there was inflammation. Inflammation we have seen, it has also a function of clearing the site. With clearing the site which was injured, you understand there is a kind of healing also which starts. So there is a granulation tissue formation. This is caused by fibroblasts which produce collagen fibers, and these fibers will be deposited. But usually these fibers are few, they are not so intense. And because of that, if fibrosis ntabwo igaragara cyane clinically ntabwo ibona keretse kuri histology. Then there will be angiogenesis or neovascularization. After this, they will have a scar or fibrosis. Here we have now too much collagen and the other extracellular matrix protein synthesis. Of course, almost of them are produced by fibroblasts. So fibrosis nuza umuntu afite inkovu nini, icyo bita keloid and so on, bizaba bigaragara niba ari ku ruhu, niba atari ku ruhu, imbere uzabibona kuri histology of any organ. Then remodeling and wound strength. So there is a scar, but the body must make sure the fibers which are there are strong enough to support that organ or that tissue itself. So remodeling also help a wound to have what we call a contraction. We'll see it afterwards. But in general, remodeling also refers to decreasing the size of the scar. Niho uzasanga ari umuntu utagize a proper tissue remodeling aza afite igisikari kinini, rimwe na rimwe ugombe kumutera imiti kugira ngo igabanuke. So all these, they will increase in wound strength and scar fibrosis, and we have had callus formation. So angiogenesis, you can ask yourself, how does our body make sure there are new blood vessels formed? So there are theories. Nobody can, with confidence, say, I know exactly which process does our body use. But there are two possibilities. They have been explored in research, of course, in laboratories. Ariko ntabwo ushobora kupima ku muntu ngo ubimenye ngo niki cyabiteye. Ubona ko vessels zaje ariko ntabwo wapfa kumenya ngo yatewe n'iyihe mechanism. So the first is from endothelial precursor cells. So these are like stem cells which we are just around there. Urabona hano ziri kuva muri bone marrow, ni urugero zigiye ibyo bita homing, ni ukuva aho zari ziri zikinjira muri blood vessel kugira ngo blood vessel izazigeza aho zikenewe. This is homing. So they go through blood vessel, through capillaries until they reach an area which was injured, which is needing new blood vessels. So when they reach there, they say they go where the blood vessel was cut. If there is an injury, there is somewhere there is an injury or cut of a blood vessel. So they go there, then they start creating budding. So this is one mechanism. So others, this is angiogenesis by mobilization of endothelial precursor cells from the bone marrow. Others say no, the angiogenesis takes place by pre-existing vessels which just have a capillary sprouting. Ni nko kuzana udushami gusa twizanye tugakura hatabayeho intervention of these endothelial precursor cells. So these are the theories, but both may be combined or not one may be true. So as humans, it is not easy to know exactly what happens in each individual. So granulation tissue in histology, so at least you can recognize the blood vessel. These are red blood cells. Around there, you see that it is whitish, but there are some fibers. There are some fibers. So this is stain, trichrome stain. Trichrome, harimo 3, chrome is the color, 3 is the free. It is a stain we use in labs, which can give 3 colors depending on the tissues which are there. So for example, the red blood cells, they continue to be red. The collagen fibers, they will be blue. And the muscles, they will be green. So that's why it is 3 color. So here in this first part, in A, you see that there are very few blue fibers. So meaning that the collagen fibers are very few. But here, where there is the fibrosis, the full fibrosis, you see that there are many blue fibers which are collagen again. So this is a mature scar, and this is just a granulation tissue when there is still inflammation going on. So the cutaneous wound healing. So the days, this is important. So an inflammation starts here on day 0. After, when we reach day 2, we have healing, which at least can be evidenced on histology. Maybe by eyes not, but by histology you can see. So there are things which start, like re-epithelialization, angiogenesis, and the granulation tissue provisional matrix is formed. But as the time goes on, you see that here, this line is showing collagen deposit. The collagen deposit increases with time. And you see that at 14 days, at day 14, you see that there is too much collagen formation. So we will now come to the applications of this chapter. I think it is what we are going to see. Maybe if you have a question, you can ask. Otherwise, you can have a short break and then come back to end this. Any questions so far? Okay, so we take a break, 10 minutes.
Lecture, sorry.
Yes.
My question is not related to the topic. Maybe I'm going to state it and you will help us after the break.
Yes.
It's about the objective of this general pathology, because it's our second time to study it, but for me, I don't know if there is not even other student here who have that problem. I don't know even the objective and the content we have to cover, so that it can help me to prepare it and concentrate on it well, knowing the roadway which can help me to reach on those objectives.
Okay, thank you for the question. I cannot say to give maybe an answer which is exhaustive, but you have seen, maybe I will have a kind of showing the place of pathology in medicine. Maybe that will help. I'll have just an illustration after the break about the place of pathology in medicine, because pathology is considered as it is the branch of medicine which links basic science and clinical sciences. So I can understand the challenge when you have not yet gone to the clinical sciences. You maybe you don't understand its importance, but it is the only branch of medicine which links basic sciences, meaning anatomy, histology, physiology, molecular biology. It links them to clinical sciences, surgery, obstetrics, internal medicine, pediatrics, dermatology, and so on. So it is the branch. So this is its main aim, if I can say so. So I had hoped you have covered, you have seen that just
Thank you.
Yes.
Yes.
Yeah, you can go on.
I was saying that you can help us to know the topic we will cover in this first part of pathology, if it's possible.
I think it should be possible, not only possible, you have that right, and that's why all the content is shown on the e-learning system. Even this presentation I'm showing is there. I actually downloaded it from there. It is in the Moodle system. So the chapters to cover, there is even there is a paper which shows the content, a Word document, the content, and then you have the list of chapters, and for each we have presentation, we have practicals for it. Everything is there. So you would.
We don't have access to it. We don't have access to it.
Who gives you access? Do you have access to other modules? Sorry?
We went in level 1 where they give us, we have used it in level 1 on some modules where they give us an enrollment key to allow us to access the module, like anatomy, we have used it, but now on the pathology we don't have enrollment key, and I'm not sure that it's the site is working well.
Yeah, the website is working because, as I said, I just downloaded this morning from the e-learning system. So I will ask because we didn't put any password for that. There are exams there, also are there, but the exams they are hidden because they have a password.
Thank you. We will check.
Yeah, the exams themselves they have passwords, but the course content no password. So that's why I don't understand it. Where is the problem? And the enrollment is self-enrollment. Yeah, so I think it is the school or the registrar or the registrar office who should give you access, because if it is a self-enrollment, the university makes sure everybody who is in that class is able to get access to the content in the system. So I will ask the coordinator of medicine or people in the register office what happens, because in previous years, yes, anybody in the second year, if there's a module, they automatically have access to that. So but otherwise for the place of pathology, I explained a little bit and I will come back on that. And another thing is that, for example, when we indicate a book to read, if you have this book, a basic pathology, everything is there, just introduction to pathology, why pathology is important, and so on. And you will see that even when you go for postgraduate, especially those doing surgical specialties, they come back to do again pathology, general pathology itself. Some of them they do again systemic pathology in order to make sure they will do things as required, especially in surgery. Of course, those doing the pathology they do more. So we can have a break. If there's another question, we will ask afterwards. So 15 minutes is now. So to make sure we finish this chapter before noon. So we come back at 15 past 10. Hello again. I hope you can see the screen, a Word document. Do you?
Yes.
Okay, this I downloaded also from the platform. So I tried to call the coordinator from medicine, but he doesn't pick the phone. So I will know maybe afterwards why you are not able to access the Moodle system. So this paper is there on just, I think it is like the first or the second document on the general pathology module system. So it's called the storyboard for general pathology module. So it shows in which week the areas to cover, or the chapters, can you say so. So for the week 1, which was introduction to pathology, so the first objective to explain the role of pathology in clinical practice, to explain the method used in pathology. Second week, cell injury and clinical practice, cell death and cellular adaptation. Week 3, it was inflammation. Week 4, it is tissue repair regeneration, what we are seeing now. So the content is there, the tumors and so on. So in brief, it is there, the things to cover in this chapter. And in this first week, I hope you could have covered this, but if not, so I can just say a few things about the objectives of pathology in general. And here there is that book I have also shown when I started, Basic Pathology, Robbins and Cotran's Basis of Pathology. This is a universal book for any student who does general pathology. So you cannot say I have done medicine or dental surgery without reading this book. So I said when I went for postgraduate. So when I reached there, I found that all the students, they knew everything about these books, and they are not doing pathology; they are doing surgery. Others then masters of dentistry, but when we are discussing, they knew everything. So of course, starting in the first semester of postgraduate, almost all students, they repeat basic sciences, including pathology, and they had to repeat also to just an overview. But for them, they knew almost everything. So because of me, I was coming from a francophone background here in Rwanda, so it was difficult to me because I had just learned pathology in French using other books. But this is a universal book in whichever country using English you can go in. This is a general. So like in physiology, you have a book considered like they could call a Bible of anatomy, Bible of pathology, of physiology, which are known to anybody. So if you want to go to America, for example, for postgraduate, they assess you about the basic sciences, and the questions they bring are from this book. So I say this because even if you don't have details in each presentation about everything, you are not exempt of knowing things which are written in such books. So this is like a general rule in medicine. Each course has a book everybody must read. So this is Robbins and Cotran's Basis of Pathology. Before there was a larger one, ibyo twasomaga cyitwaga Pathologic Basis of Diseases, also for Robbins. So Robbins ni umuntu witwa Cotran, n'undi Robbins ni watangiye kwandika ibitabo mu myaka y'igihumbi 1970 gutyo, yapfuye muri 2008, yishwe na kanseri yo mu jisho. So he's very known because of his books. There are even books they call them basic review of Robin's basic pathology, I think it's called review. So irimo ibibazo n'ibisubizo. And these are questions you will get whenever you go, if you want to go to practice or study in America, in Europe, in Australia, and whenever. These are the most of the questions will come from this book, this book, and that version of exam. So it has just, there is a soft copy of that. So this book, I know in the library at medicine is there. There are soft copies. Of course, it is very heavy. You cannot attach it on email, but there is a soft copy of it. We have hard copies there at the library. So that's in general what I can say. So otherwise, the plan is there, the objectives here are listed, and how will you assess you have achieved the objective, how will you assess the outcomes, everything is there in the Moodle, on this plan. So going back to so I hope you can see this PowerPoint. Okay, so I am just going to go through very quickly because it was not the topic of today, because for the question asked by a colleague. So this is an introduction to pathology I used to teach the pharmacy students. So meaning that it is not it is very much adapted to them. So it is somehow shallow. So I will just give an overview of the pathology and its place in medicine. It contains other things which I will not present here. So like or the other chapters were summarized into few slides because the pharmacy students, they don't need to know much as medical students. So pathology itself, it means the science of disease or science of suffering. So science of disease. So it means if your intention is to treat a disease, you must know the science of the disease. You cannot treat effectively something you don't know the science behind it. So there are 4 parts of a disease process. There is etiology, where we see origin, causes, or risk factors of that disease. Aho bakaba wenda kanseri y'igifu, risk factors n'iki, ni infection to Helicobacter pylori, kurya ibiryo byo mu supermarket and so on, kanseri y'ibihaha, risk factor n'iki, ni itabi. Pathogenesis now, how that factor causes changes until there is a disease. This is pathogenesis, the mechanisms by which the factor or a cause will trigger a disease to happen. Then structural and functional changes, of which are the characteristics of a disease. So meaning someone has a cancer of the liver. What are the structural and functional changes? Structural means, is there swelling? Does it destroy surrounding tissues? Does it bleed? Is it necrotic? These are the structural changes. Then there are structural changes under microscopy. How will the cell look like? And so on. And the functional changes. For example, there are tumors which produce hormone. Anga dukunda kubona ugasanga umuntu afite kanseri y'ibihaha agakora iyo kanseri igakora hormone ubundi zikorwa na adrenal glands. Ibyo bita paraneoplastic syndrome, ibyo tuzabibona. So these are functional changes. Hari no gutuma niba yafashe umwijima akazi wakoraga gukora albumine andi ma proteine ntuci yakoze kubera warwaye ibindi bibazo. So there are functional consequences. And here, these are very important in medicine, because, for example, ushaka kuvuga ngo uriya muntu arwaye kanseri y'ibihaha nabibonye, that's enough, but it is not enough, kubera ko muri oncology which is a science dealing with treating cancers. So oncology is a science dealing with treating cancers. So for them, they cannot treat a cancer because they say that this is a cancer of the liver or the stomach. It is not enough. you must say, what is the cell of origin? Is it an epithelial cell? Is it a lymphocyte? Is it a endothelial cell? Because the treatment will depend on the cell of origin. So usually this is in practical terms, what we do in pathology is to identify if it is a tumor, the cell of origin of that tumor, the grade, how is it aggressive? For some cancers, we go on to say, what are the receptors? Receptors zirya twabonye zakira growth factor. Iyi cancer ifite izihe? Niba ari breast afite estrogen receptor, afite progesterone receptor, afite epidermal growth factor receptor. Iyo afite estrogen receptor, oncologist ahita amenya ko ndamuvuza umuti witwa tamoxifen. Niba afite atayifite ntabwo amuha uwo muti. Niba afite receptor to epidermal growth factor receptor, ahita amenya ko arimo umuti witwa herceptin uhenda kwigura miliyoni 70. So ibyo byose it will depend on what we have indicated the patient is having. So that is in the practical way. Otherwise, there are other people who come, they say, we think this person is having maybe a tumor in the kidney. We do histology, we find it is just a tuberculosis. I saw like 2 cases whereby they say this child is having a cancer. When I hope it is just tuberculosis because it's extrapulmonary tuberculosis which cannot be tested in sputum. So we diagnose cancers, infections, many other things. Hari abaza badafite ganglion cells in their colon, abana batoya indwara yitwa Hirschsprung disease. So this is not a thing you can just diagnose by eyes, it is histology. And when these cells are not there, ganglion cells, then you tell the clinician, okay, here the cells are limited here, so if you do surgery exactly here, you will cure the child. If someone is doing a surgery of, let's say, a cancer in the brain, a surgery. First of all, he doesn't know it is a cancer. So while he's operating, we cooperate. Then we can test if it is really cancer. When you confirm it is a cancer, then the next question will be, if I cut here, will I remove the whole cancer or it will not be completely removed? So the margins, we can test inside the theater, surgical room. So you can test that in the orient, the clinician say, okay, cut there because there the cancer has not reached there. If you cut by through this area, you will cure the patient. So there are many applications of it, and in research, of course, there are. So mainly cancers, they cannot be diagnosed in any other way than pathology, but also some other disease. So usually concentrate on cancers or excluding the cancers and so on. So, okay, so this is etiology, pathogenesis, morphological changes or structural changes, biochemical changes. Kuvuga bya bindi byo kuvuga kanseri iri gukora iki, iri gukora hormone, iri gukora iyihe cytokine, then bakamenya twayivura gutya, cyangwa se umurwayi. Hari umurwayi tuvuge ufite iyo bita pheochromocytoma, which is a tumor arising from adrenal gland. Abakora hormone nyinshi cyane za adrenal gland, akagira complication, Cushing syndrome, ibiki byose. Noneho izo biochemical changes they are measured in pathology, but not anatomical pathology, in clinical pathology, muri biochemistry. It is a branch of pathology because the pathology includes all the laboratory medicine sciences, but anatomical pathology, it is on one side, and or the others are called clinical pathology, meaning biochemistry, immunology, serology, microbiology, or this genetics, we call them clinical pathology. In a difference to, so in a clinical pathology, things can be measured by machines. While in anatomical pathology, it is only a person who can say there is a problem there. So the test can be done only by the person himself. While in a clinical pathology, the machine does the test and interprets. So there are three fields of pathology. I was explaining anatomic pathology, in which we have three ways of doing a diagnosis. There is a cytology. Here we just look at the individual cells, pap smear, bakura kuri cervix, ku mudamu, niba shakura afite cancer y'inkondo y'umura, and so on. There is a final need aspiration. We use the needles, tukajya muri tumor, tugakoramo individual cells. Yaba ari muri breast, hari n'igihe dufata iby'imbere mu bihaha, bifite ikibyimba ku bihaha cyangwa ku mwijima n'ahandi hose. So tukareba niba ayo maserire afite ikibazo. Iyo dusanze ari cancer, then you say the cells they look cancer, then you must do this and this. So cytology usually it is used as a screening tool, not a diagnosing tool. Keretse iyo usanze ari inflammation ugakora further test ukayibona tuberculose, aho biba birangiye diagnosis. That for cancers is screening. When the cells look bad, then you say, I see that it is a cancer, but I cannot know the grade. So biopsy, it is where they take a tissue or an organ. Sometimes a small biopsy for diagnosis confirmation. Then if the cancer can be removed completely, they go for excision. But in our countries, abantu baza kwivuza batinze, akenshi usanga yaramurenze. Icyo dukora, it is confirmed it is a cancer, then they give a palliation. Palliation no kuvura umuntu utagamije kumukiza, ahubwo kumufasha kuba mu gihe asigaje kubaho yaba atababara, and so on. So nabwo bahabwa imiti, hari abahabwa imiti ya palliation, hari n'abashobora kubagwa ariko ari palliative atari curative. Curative, you have intent to make sure the disease is cured completely. So another method is autopsy. Of course, autopsy, it means someone has died. Sometimes it is necessary to make a diagnosis after death. It is, or maybe necessary, it is not a good word. So in some scenarios, it is the only possibility. Hari igihe umuntu apfa, abaganga bose barateranye aho bishoboka hose ariko barabuze indwara, then umurwayi akarinda apfa batarayibona, wakora autopsy bakaba aribwo iboneka. So autopsy is of two kinds. There is a clinical, niyo navugaga, hakaba na medical legal. Medical legal ni ukuvuga umuntu bakeka ko yishwe cyane cyane. Hari uwiyahuye, hari uwasanze yapfuye ku muhanda, hari uwapfuye, uwarwaye akanya gato cyane katageze ku masaha 28, nubwo byaba byagaragaye ko yarwaye indwara wenda itaramenyekana, uwo ngo nawe barwa muri medical legal. Niyo uzasanga police, ubu ngubu ni RIB ibijyamo, yo mu mahanga ambasade n'ibikora ibijyamo, and so on. Yari nk'umuntu wo mu gihugu wapfiriye hanze, so ambasade yaho ifite akazi nka kanyuranye, harimo n'akameze nka karibu gukurikirana impamvu umuntu yapfuye. So this is medical legal. Mu Rwanda cyane cyane bikorerwa ku hospital ya hafi ya hospital ya Kacyiru. Hospital ya Kacyiru ni hospital ariko hari ikigo cya Rwanda Forensic Lab iruhande yaho, nicyo kibireba. Otherwise for us we can do clinical autopsies, which must always be done by pathologists. Kubera ko umuganga wavuye umurwayi ntabwo ari wagomye no kumukorera autopsy, kuko ashobora gusanga umurwayi yapfuye kubera ereri. Icyo gihe ntabwo aba yemerewe, ubundi ntabwo yemerewe gukora autopsy, igomba gukorwa mu pathologist. Pathologists are always considered to be neutral mu bintu byose. Neutral ni ukuvuga agomba kugaragaza ikintu nk'uko kiri, yaba ari umukorege wakoze amakosa cyaba atari byo byose akagaragaza uko kuri kumeze. So clinical autopsies must be done by pathologists whenever possible. So these are the methods. So the second field is clinical pathology. I was saying hematology, chemistry, molecular biology, immunology, then microbiology. Hari abayishyira muri clinical pathology n'abayishyira separate. So all are fields of pathology, but in this general pathology and the systemic pathology, we will concentrate for us. We will concentrate on the anatomic pathology. Ariko hazajya hazamo n'ibintu bya clinical pathology. So for the question why pathology, so this is how it is illustrated. I have someone explained this. We have basic sciences, what you can call basic sciences, but anatomy, physiology, themselves they are basic sciences. Genetics, biochemistry, microbiology, and cell biology is the basic science. But microbiology, it has a component of basic science. Muri 2 parts. Kimwe na biochemistry, ibyo mwita clinical chemistry, ni mwiga na mwita biochemistry ubwayo. So kimwe ni basic science, ikindi ni applied to clinics. So all these we consider them as basic sciences in general. Then pathology is also, muzasanga mu bitaro bimwe na bimwe bayifata nka basic science, abandi bakayifata nka clinical science. So niyo mpamvu ikunda kujyamo hagati, but it is here because it is considered the link between basic sciences and clinical sciences, monanga surgery, pulmonology, radiology, gynecology, urology, cardiology, neurology, neurosurgery, dermatology, oncology, and so on. So pathology is the one linking them. Nyirango nimunabireba neza n'uburyo mwiga, if you follow the flow on how it should be, nibwo bwa mbere batangira kubabwira indwara completely muri pathology, kababwira ati if you are discussing cancer of the esophagus, bagatangira definition, its etiology, its pathogenesis, its clinical manifestation, how it is diagnosed, how it is treated, and the outcome, the prognosis. So niho mutangira kwiga indwara in full, nubwo treatment akenshi itibandwaho muri pathology. Kenshi ntabwo ibandwaho, ni ukugarukira kuri diagnosis, how it is done, and the prognosis. Yaba avuwe yaba atavuwe bigenda bite, ni iki gishobora kumuba. So and you will see that it combines the basic science. Kwa bakubwira cancer yenda ya esophagus, how do you stage it? Ngo yaramurenze cyangwa iracyari hafi. Kumurenga bivuga iki cyangwa igifu? Ni ukuba ko iba yarenze, let's say tunica, the muscular. So urumva hahise hazamo histology. So bakavuga ati yenda yaragiye yafashe kuri omentum. This is anatomy. So it captures the basic sciences for you to understand the extent of that disease and therefore think on how you can treat that disease. So that's why they say it links basic sciences, which are considered here as roots, to clinical sciences, which are considered as branches of a tree. So how the history uko yagiye ikura, kera hari abantu abagiriki baravugaga ngo habitaga hemoro pathology. Baba ko umuntu agize afite for humans, ni nka fluids. Baba ngo afite amaraso, afite mucus, nk'amacandwe n'ibindi bisa n'amatembabuzi asanzwe, akagira black bile na yellow bile. Yellow bile is what? Ni urine. Black bile ni bile n'ubundi biva mu mwijima. So bo mu gihe cyawo cya Hippocrate baravuga ngo ni ibyo bigize umubiri. Ariko no bakavuga ni uburwayi umuntu arwara ryari. Baba umurwayi iyo hatabayeho balance hagati ya biriya bintu bine. Ese amaraso yagabanutse, mucus irazamuka, ese bile, black bile yazamutse cyangwa urine yazamutse. Ntabwo dushobora kubisuzuma ngo tuve ngo nyine ni bya cyaba byata agaciro, kubera ko n'ubu nguyu umuntu aje kwa muganga asanga bavuga ati uyu muntu amaze iminsi 2 cyangwa umunsi atihagarika. It is a very alarming sign ko hari ikibazo gikomeye ashobora gupfa mu masaha make. Niba ziyongere cyane nabwo ashobora kuba ari diabete. So ntabwo rero twavuga ngo bari wrong, niho ubumenyi bwari buri. So nyuma abantu baravuga no, abanyegiputa uko barege bakomeye nabo na Bibiliya irabyerekana, rero yari supremacy nk'uko Amerika imeze. So abanyegiputa baravuga ati no, ibyabagira iki ntabwo ari byo kuvuga ngo ni humans bazagize icyo bavuga, no, ahubwo muri buri ndwara haba habayemo solid change. Ukuvuga either habayeho swelling cyangwa se habayeho kugabanuka kwa size. So solid organs show changes in a disease. Abone ibyo nabyo ntitwabihakana, kubera ko umenya ubwirwa n'umuntu ko afite cancer ni ubona habyimbye cyangwa ahantu hashwanyaguritse. This is a solid change. Muri haza cellular pathology mu myaka y'700 abitwa Virchow, ari nawo ufatwa nk'umuntu muri rusange watangije field of pathology. What about no, in every disease there are cellular changes. This also we cannot say it is not true, because in almost all diseases we have cellular changes. This is what we were seeing, or we will see in, for example, in tumors. There cannot be a cancer without cellular changes. Noneho nyuma mu myaka ya 1900 bavuga ati no, ahubwo muri buri ndwara haba hariho molecular change. So ni nabyo nashaka kuvuga kuri cancer. Ntabwo bibaho ko hari cancer ibaho hatabayeho genetic change, molecular change cyangwa se mutation. So in evolution of pathology, how it progresses until now. So nahanga bigeze. So this is history. So the method used in pathology, we use specimens, of course, physiological fluids, urine or pathological, such as pus, ascites, pleural fluid, pericardial fluid, cerebrospinal fluid, and so on. Endoscopic samples. Endoscopy, it means no endoscopy. Scope means to see somehow. So no gukoresha amaso yawe ukareba imbere, ukoresheje icyuma ukareba imbere muri organe runaka. Birumvikana ko kenshi bireba organe zifitemo lumen imbere. So no azavuga ngo gastroscopy, ni ukuvuga icyuma wohereza mu nda kinyuze mu kanwa kikinjira kigenda kireba esophagus imeze ite, igifu kimeze gute. Niba ari bronchoscopy, no kwinyuza muri bronchi and so on. Colonoscopy iba yanyuze hasi muri rectum then ikazamuka muri colon. Aho rero iyo igezemo haba hariho udukoroshe duto cyane umuganga akoresha ko and how it should appear under endoscopy, bireba n'amaso. Then aho ubona hari ikibazo ukoresha utwo tuntu ukadukomanda tugafata small parts of the lesion, then kakazoherezwa muri histopathology bakareba what is it. So there is true cut needle biopsies. Hano kwezo no urushinge runini rugenda wagera ahantu ukora icyo bita nko shooting, nko kurasa, harakantu urashisha noneho agatishu kagahita kikura hahandi ya gishinge cyari kigeze kaza bakagapima muri histology. So bikunda gukoreshwa muri liver, muri kidney, muri prostate, ariko hari hose birakoreshwa. Diagnostic excision, no kuvuga umuntu wabonye ko afite ikibyimba ku ibere, abati biragaragara n'ubundi ni ikibyimba, ni cancer bitewe na bya bindi warizuba, it is infiltrating, it is destroying and so on. Kavuga ati reka n'ubundi bagikureho n'ibere bakore ikibyimba cyonyine cyangwa bagikuraneho n'ibere. So uzasanga mastectomy yakozwe, hysterectomy no kuvuga gukuramo iterisi yose, lung resection, colectomy bagakuramo colon yose cyangwa se igifu cyose. Ibyo ntabwo ari ibintu biri mvuga byo mu bitabo, ni ibintu biba hano mu bitaro byacu, hano birakorwa byose hafi buri munsi. Ikintu badashobora gukuramo cyose ni small intestine, ariko ibi byose bindi babikura. Of course brain you cannot remove it, you can remove a part which is sick, but so until today the pathological diagnosis is considered the golden standard. No kuvuga iki antanze urugero tugiye mu kuvura abarwayi ba kanseri bavurwa n'inama y'abaganga, ntabwo ari umuntu umwe. So after pathology has said this is a cancer, hakorwa iki? Hatumizwa inama, akenshi ari scheduled nka search kavuga ati muri gynecology inama iba Thursday yo kureba abarwayi ba kanseri. So icyo gihe abarwayi ba kanseri bivuga iki? Umuganga wamusuzumye bwa mbere unamukurikirana, umupathologist wawemeje ko ari kanseri, umuradiologist wakoze scanner cyangwa MRI akabona aho kanseri igarukira, niba yarageze ahantu kure, baraterana. Noneho umuklinisiye bakavuga ati jewe ni ibi ngibi nakoze narabaze, ariko je nabonaga rwose atari kanseri. Umuradiologist akavuga ati nabonye ibi n'ibi. Umupathologist wakavuga twebwe twasanze ari kanseri yitwa gutya, yakomotse kuri izi selile, ifite receptors zimeze gutya and so on. So akenshi nta wundi gira icyo yongeraho when they pathologist confirm this is a cancer. So nta wundi uvuga ngo ndumva atari. So that's why it is called the golden standard diagnosis. It means niyo igomba gutanga icyemezo cya nyuma cy'uburwayi. So izo nama akunda kuzita tumor board, uzasanga ibihugu byose bivura kanseri izo nama barazita. So history of pathology, aba ni abantu bagiye babikoramo and so on. Jean Baptiste Morgagni umufaransa, Karire Rokitansky, Rudolf Virchow wandi navuze wa cellular pathology and so on. So mu Rwanda anatomical pathology yashinzwe ukangana 1967, ariko ubundi umuntu washinze School of Medicine yari umupathologist. And a question? So yari umupathologist. Murabizi ko kaminuza y'u Rwanda yashinzwe n'abakanye Canada. So bagiye gushinga kaminuza, bagiye gutangije amashami abiri, science ngira ngo n'ibi bijyanye n'ubuyobozi, ariko baravuga ati ariko kwa gutangiza ishuri ry'ubuvuzi, so basanga badafite capacity. Bamenya ko Kabgayi hari umuganga wari waje muri mission gusa ya kiliziya, baramubaza ese waje ukadufasha ko nta wundi muganga tuzi nahangaha, nawe ukadufasha kaminuza ikazatangirana amashami 3 na medicine irimo. So umuganga yitwaga France van der Rohe, umuhorandi, igiko aribo bategeka bari bamaze igihe bategeka u Rwanda, ariko independence yabonetse so muri 1963. So niwe rero watangije School of Medicine, akaba n'umupathologist, ahita atangiza na pathology lab aho muri CHUB. So iyo labo yakomeje kubimwe kugera mu myaka 2009 ubwo Faisal yatangizaga yayo Butaro nyuma gato 2012, ariko yo yasaga naho atari pathology lab kuko nta mupathologist wari uhari. CHUK 2013, Rwanda Military Hospital 2016, ni nizo zihari gusa uretse private imwe ihari. So this is in general. So for pathologists until the 1994 there were 4 Rwandan pathologists. Ntekereza ko bose bashaka kuba bakiriho ariko ntabwo mu Rwanda nubwo bajya bazi n'ahanga ariko hanze. And one of them had been a minister at a certain time. So afterwards, then we had trainings, and now we are more than 21 in the country. So abandi bari hanze, abandi bari kwiga and so on. So how do we do? In general, muzabibona no muri lab ari ibitaro nira ya school iri muri campus Rwanda. So when you do surgery, you put a specimen in a container birimo fluid bita formalin. Ndihuta cyane. Formalin ni fluid ituma ihita fixa tissue aho yari serire uko yari imeze kose ihagararira aho ngaho. Iyo formalin yitwa fixative. Ikimaze niki no kugira ngo amatishu atabora. So muzayibona nk'imirambo babika igihe kinini uko bayiteye formol kandi ngo tissue zitabora zisa naho zumye. So hari amategeko abigenga uburyo iyo fluid ugomba kubingana pari raporo ya size of the specimen. Nge ntabwo mbitinda. Siyo mpamvu ibi binini no kuvuga ko harimo a very large specimen, hari zijya ziza ziri mu zidashobora kujya muri containers zateganijwe bagashyira mu ndobo zino zisanzwe ko ari binini, ari yo cya kibiro 12 and so on. Ari tumor. Akaba no duto twavuye muri endoscopy twari duto cyane tungana n'agasaka kamwe. So after that, the pathologists will examine the tissues which came kureba niba zifite gross lesion igaragara n'amaso. Tuvuge niba bazanye mastectomy cyangwa gastrectomy, igifu cyose cyangwa igice cyacyo ugomba kureba ese ko bakizanye ubundi ahari ikibazo ni he. Ukakivuga ati nasanze ari tumor ingana gutya na gutya and it was maybe closer to the margin. When you imagine ikibazo gihita gisubira kuri surgeon. Why did you do surgery and don't remove the tumor in whole? So icyo gihe ikibazo kimugarukaho nyuma. So iyo urangije kubikora ufata uduce duto watoranije ukadushyira mu tuntu bita cassette. Hano hari tubiri tw'umweru, naho two ducassette tuba dutowe ku buryo tuzatuma fluid zinja cyangwa zisohoka muri process kurikira bita processing. So iyi ni processor waga muri sashibe, haba processors z'amoko menshi. No muri lab ya kaminuza harimo processor ariko idakoze gutya, iyi niyo bita circulaire. So ikigamije ni iki? Nuko muri yo iyi ni process imara nk'amasaha 18 ubwayo, akenshi ni 18 tissue process. So akenshi bishyiramo nimugoroba ikarara ikora, bikarangira ugasanga saa 1 za mu gitondo nibwo irangije akazi mukazikuramo. So hari ibintu byinshi bikorwamo. So I see ni practical. So yurangije ufata ka gatishu kagakura muri ya kasete. Hari reagents ibaje muri paraffin. Iki cyuma cyitwa embedding station, nacyo kiba kirimo paraffin. Ya paraffin ni ibintu bimeze nka buji, niko bimeze, binakorwa mu bintu bimwe. Icyo baba bayishakira nuko iyo hashyushye cyane kuri dogere 60 irashonga ikaba nk'amazi. It infiltrates through the tissue. Na hari espace hose ikajyamo, noneho igatuma ka gatishu gakomera, ndetse ukayikikizaho na paraffine inyuma, ka gatishu kagakomera nkuko hano ntibiri kugaragara neza. Noneho icyo ubushaka ni iki? Iyi ni ya cassette. En principe ushyiraho izi nimero, buri murwayi afite nimero ye kuko ntabwo ashyiraho amazina, cyangwa ari maremare, kandi ikindi confidentiality. When I am diagnosing cases of history, usually I don't read the names. Ni gake cyane nyasoma, ndeba nimero ya umuganga yashyize kuri request form, nkareba niri kuri slides nyako bihura. Kenshi sindeba amazina. So harimo nicyo kintu cyo kwirinda ko umenya kanaka nabonye tishu ya minister runaka, ngo ibyo nicyo wabirinda. So mpamvu hageze izi nomero. So you cut, ukoresha icyuma cyitwa microtome, a thin section at 4 micrometer. 4 micrometer ni gato cyane, kugira ngo urumuri rwa microscope ruzanyuremo ubone details z'amaselile yose. So then you have a steroids that you stain using a stainer. Na ni stain masaha nk'isaha cyangwa amasaha 2 biterwa nuko iri set. So then the steroids will be ready, ziriho za nimero z'umurwayi, then bakabihuza na request form, haza request form zazo Faisal. So then ukajya kuri microscope. So this is a multi-head microscope, ishobora kujya ahantu 5 kuba umwe ajya hano akigisha abandi bose bari hano 4. So nowadays kuko abonye no dushyira no kuri kamera, and so ukashyira kuri screen kuri ushobora gukurikira muri benshi. So things are moving. Ibingibi mu minsi mike tuzatubikoresha bya microscope. Haje icyuma ushobora gushyiramo slide ikayiskana, waba uri mu rugo, waba uri mu mahanga cyangwa urihe, bakavuga ngo hari ka twaguhaye turebere icyari. So ukabisomera buri hose kuri internet. So izo machine zirahari ari CHK ibutaro ni Kanombe niho zimaze kugera. So then you report ibintu wabonye, urabyandika muri computer, then report igasubira ku muganga wayisabye, akaba ari we ubwira umurwayi ati icyo bakubonyemo muri pathology bemeje ko ufite ikiniki, igikurikira bigiye gukurikiraho ni. So that is the place of pathology in clinical practice, but I think it can help you also to understand the in science, in medicine itself, its place. So iyi yari report y'umurwayi umwe, so amazina na identification ko arabisibye, ariko yari CHK. So yari afite endocervical adenocarcinoma. So yari afite kanseri ya inkondo y'umura. Ni kanseri irasanzwe, ntabwo ari isanzwe ya iterwa na HPV n'indi. So hangwa hano hariho ibintu byinshi, harimo no kuvuga stage. Grade 2 no kuvuga ko ifite ubukana buringaniye. Grade 3 ifite ubukana bukomeye bwo gushwanyaguza. Grade 1 iba igenda gahoro. So yerimo hagati yari grade 2. So stage P, T1, so TNM tuzabyiga, ariko ni T ni tumor ingana gute, N escari lymph node zamaze gufatwa, M ni metastasis, hari organe iri kure iyo kanseri yabashije kugeramo. So iyo twanditseho XX biba bivuga ko iyi information tutayifite, cyane cyane iyo ari small biopsy. Ariko yari large biopsy nka bakuyemo nk'igifu bakazana lymph node, ibi turabireporting akaba lymph node twasanze nta kiri mu dushyiraho 0. Metastasis ibyo ni radio ibyerekana, nivuga ati mu gifu mu mwijima twabonye byaragezemo cyangwa mu bihaha. So there is always a collaboration between different branches of medicine to decide the way forward. So, so I want to ask the one who asked the question, if at least you can understand the place of pathology, not only in the clinical practice, but also in the medicine itself.
Yes, lecturer. Thank you. You help us to understand it very well. And now we can know the place where pathology is included in clinical studies and even in clinical practices, even in the hospital, how pathologists work. It's more information which will help us to decide if we can also be a pathologist in the specialty. Thank you very much.
Okay, thank you, welcome. So other things maybe I did mention is that usually in research there will be the center. Because most of people doing research, they will need a final diagnosis. So final diagnosis is always done by pathologists. So they tend to be involved in most of research activities. Gusa concern igihari ni mentalite, mindset y'abantu. So abantu benshi aragenda akabaga akabata this is not a cancer, akajugunya. Wa murwayi ugasanga nyuma y'ukwezi agize cyangwa y'amezi cyangwa y'umwaka agize ibibazo, wazareba ugasanga ibibazo yagize ni kanseri yari yarageze kure. Wa wundi igihe yamubagaga wende kanseri ikiri hafi bashaka guhita bavura bitarakomera. So icyo rero ni ikibazo kijyaye cy'abantu kumva ko nshobora gukoresha amaso yanjye nkamenya ko yari kanseri cyangwa atari. Ngo twagiye tubireba nka hari surgery ziganje nko appendicitis, gukuramo appendix kubera appendicitis. So ugasanga wigira no, this is just appendicitis. But there is a time say no, bring or the specimen of appendix you remove every time, you just bring them to pathology. So ntabwo hashize amezi abiri tutabonyemo kanseri ebyiri. Icyo ni ikibazo kigaragaza ko there are we are evolving, the country is being developed. Ntabwo abantu bazakomeza kuvura nka byakimeza. This science is coming up. So tugomba kugeza science nk'uko kandi bayikurikiza, kandi urumva umurwayi aramutse bati jewe kanseri wayimbonyemo yarandenze, kandi uwambaze cyagihe yari irimo arabijugunya ntiyabipimisha, ntiyambwe ngo mbipime ngo mbyange nisone. Urumva ni bya bindi bikurura imanza mwumva runaka bamuciye cyangwa ibitaro baciye miliyoni 60 cyangwa 100 kubera ikibazo kinini. Naho ngaho bituruka negligence cyangwa kwishyiramo kuzi ibintu byose cyangwa ko wowe wabishobora byose. So medicine is about a collaboration between different specialties. So although we are pathologists, nta nubwo tuvuga ko buri gihe ari twe twaba tuzi ibintu byose kuri buri murwayi. So usually we call the clinician, we say, so yes, doctor, colleague, you have said this patient you suspect maybe let's say a benign tumor of the uterus. But for us, we are not seeing that. We are seeing there are malignant cells. So clinically, how is the patient? So to come over. Ameza gute, yataye ibiro, yagize gute. So we correlate the clinical information. We go for radiologists, because radiologists hari mwakoze ecography, ultrasound. So how did you see the endometrium and so on? So tugakusanya makuru yose then to give a diagnosis. So ntabwo rero natwe dutanga diagnosis blindly. Icyo kivuga iki rero, amakuru abandi baganga batwohereza agomba kuba ari detaye, avuga ngo twabonye ibi nibi natwe tukabijyanisha, because we are medical doctors, we understand clinical manifestations and so on. We must correlate all these things. Kwako no mu bitabo tuba dukoresha na standards tugomba, we must correlate these things. So hariho byabagaho cyane biri kugabanuka, ugasanga cyane abaganga ba kera agafata biopsy akohereza wenda agashyiraho n'izina ry'umurwayi, rimwe na rimwe ntanavuye ngo yavuye ahangaha. So consequences ni ikirere icyo gihe it is just ni ukutaba responsable ariko ni umurwayi wigwamo. Icyo gihe bigeze ku muganga pathologist cyakora niki arareba agasanga tuvuge ati ni cancer. No se cancer ndareportinga ko ari iki, because I must know exactly which is the organ. Kushobora gusanga yari lymph node. Niba ari lymph node nkaba nsanzemo adenocarcinoma iva muri epithelial cells kandi lymph node itagira epithelial cells, ni ukuvuga nimba babona adenocarcinoma ntabwo ndabafashisha umurwayi, ahubwo icyo gihe ngomba kumenya ese koko ni iyavuye muri lymph node yavuye. Niba yavuye muri lymph node ndahita mbabwira ni afite kanseri mushaka yaturutse, kubera ko idashobora kuba yaturutse hano muri lymph node. So icyo igihe udatanze amakuru ahagije ku wundi muganga wasabye ko agira icyo agufasha, icyo gihe bidindiza umurwayi, ariko nawe uba werekana poor performance na poor collaboration. So niyo mpamvu gutanga amakuru ahagije buri gihe biba ari ngombwa. Otherwise umupathologist aramutse nawe abaye sinzi uko nabivuga, nk'umudigitatire yavuga ati okay bampaye biopsy ngewe ndaripotinga ibyo mbona. So icyo gihe niba wabonye ikintu wirinda gutanga igisubizo cyanyu, nawe ukora description ntushyireho igisubizo ukamwihorera. Ubundi ni uko wakabonye kubigenza, ariko icyo gihe umurwayi aba yiguye. So niyo mpamvu usanga dufata steps ukongera ukajya gushaka wa muganga mukaganira, byose bitwaye umwanya yo gusubiriza wa wundi. Hari abandi bari kureba ntubu ukibarebye nisone ugasanga hari ibintu byinshi bipfuye. So the clinical information which is as far as possible is very important. So otherwise in this presentation for pharmacy students, so chapter only cell injury, adaptation in death, what you have covered, the main information and so on. So we can go back to tissue healing and repair if you have no other question. Okay, so I will be as quick as possible to make sure I finish at or before noon. So we were about to start this part, healing of cutaneous wound. So impamvu yayo nuko twayifashe nka prototype. So muzajya mubibona mu gihe mwiga indwara ari hano muri pathology ari no mu bindi, ntabwo ushobora you cannot discuss all diseases which exist. That's why when, for example, you are discussing a GIT, gastrointestinal tract syndrome, gastrointestinal tract system, you will see that we always choose the most common disease or the most prototype of disease to discuss. So we cannot discuss everything. So here we'll discuss how a cutaneous wound heals. So a wound of the skin, if you understand. So the healing can be of the first intention or secondary intention. First intention ibaho ryari ni igihe niba hari hajemo incision ukata mu ruhu, mu gihe healing yabaye ibice byari byatandukanijwe no gukata byasubiranye kandi buri cyose kirebana n'icyo bisa. Nabivuzeho ka if it is epidermis, it is against another epidermis part. Dermis against dermis, muscle against muscle. So ibyo byakozwe kandi ntihabemo infection, no an infected surgical incision, buri gihe no kubigenda ukamudoda neza n'indodo zikwiriye. So healing by first intention uzasanga rero agakuva ari gatoya ndetse mu mezi make kagende burundu biye kusagara ko yigeze abaho. So for second intention, the edges are not lined up. You know, this is what I was explaining when I was saying sometimes you can claim to be a good doctor, but the patient, they will just judge you with these small things, not about the science, because they don't discuss with you the science. But in practical ways, utuntu duto dukora gute, udoda gute, umuvugisha gute, these are things which make them happy or unhappy. Umuha amakuru akwiriye, ukumuha amakuru akwiriye menshi ashoboka, mu buryo bwa nyabwo n'igihe cya nyacyo, kutamumena wangu ugenda uvuga hirya no hino ngo nabonye kana kameze gutya. So ibyo byose ni ibintu bituma umuganga mwiza cyangwa mubi ujya uhora mu manza cyangwa utazijyamo, nubwo rimwe na rimwe ushobora kuzijyamo atari ikosa ryawe cyangwa se byabaye mu ikosa, habayeho incident ishobora no kuba ku wundi uwo ari we wese atari we wayiteye ubwawe, haba ari ikintu cyiza. So ushobora gutera anesthesi umuntu akayorera agahita apfa. Iki ni ibintu bibaho, ariko wenda ntibibuza ko yitaba inkiko kubisobanura and so on, ariko at least iyo ni science aspect, hano akavuga ati biriya bibaho no mu bitabo biravugwa, n'ahandi bibaho, no muri Europe bibaho, ni ikintu kibaho, ntabwo twarenganya uriya muntu. Ariko niba basanze wamubaza ukibagirirwamo ikintu, icyo ngicyo murumva haba hari ibibazo. So healing by first intention, so there was a focal disruption of the basement membrane and the loss of only a few epithelial cells. So this is an example of surgical incision. Binabaho ko n'igihe ugiye kubaga umuntu ntabwo ugomba kunyuzamo fistula inshuro ebyiri, ngo ubanze unyuzemo wongere unyuzemo, biba byabaye ikibazo. Ugomba kugenda straight forward wadesize ngo nanga ngomba kunyura. Abagitangira nk'abanyeshuri ushobora kuba ugititira, wakozaho bisitura ukagira ubwoba, ukongera ukabikoza ahandi wari wahatoboye imisoro, birumvikana, ariko nyine ni ikibazo. So healing by first intention, you see that here after 24 hours, so icyambere nuko incision yari yanyuze muri epithelium, inyura muri dermis, inyura ndetse ikata n'ama blood vessels of course within the dermis, then igera mu hypodermis ahari flat. So in a few hours there will be a clot. A clot is to do hemostasis, guhagarika kuva kw'amaraso. So there are inflammatory cells around here which are neutrophils and so on. Hano hejuru akenshi hazaho akantu kameze nk'aga bita scaban cyangwa nk'akantu k'agakoko, hano hose akenshi nyine ari nk'amaraso yapfutse. So within 3 to 7 days, what you see here is that the epithelial cells have started to cover the part which was cut. Of course, birebye inyuma n'amaso urabona ko hagifunguye, ariko munsi epithelium yatangiye gukura. Birumvikana epithelium ntabwo ikuriva hejuru, iva hasi, kubera these are basal cells, nizo zigenda zikura zikavamo izizo hejuru. Uko iminsi ishira zagenda zizamuka, hanyuma hano hazi izindi basal cells kugeza igihe hano hazuzurira nk'uko ubona hano hasi. So muri dermis murabona ya blood vessel yakaswe nayo, maybe you don't see it clearly. So ahangaha the blood vessel which was cut here, you see that it has created branches. Imwe twabonye bya budding cyangwa endothelial precursor cells. Icyo ari cyose kibitera nuko habuzaho new vessels. And the inflammatory cells here were neutrophils, ariko ku iminsi ishira hazamo macrophage. So macrophage, they come mainly to clear the area. The lymphocytes or neutrophils, they fight. Macrophages, they usually come to clear things. Ntabwo ziclearinga bacteria gusa, zinaclearinga dead tissue debris. Because, so God did this because he knows if the dead cells remain there, they will trigger further inflammation. So God put there a mechanism by which the macrophages must clear the area from these dead tissue debris, the bacteria, the foreign bodies, whenever possible. And after weeks, you see that the epithelium is completely restored, and there is a fibrous reunion. Naza vessels zarakuze kubera iki ntabwo hano zazi branch twinshi twagabanutse yongera iba nkuko yahoze mbere hano batarayikata. But you see hano ko hitsemo gatoya nukubera iyi wound niwe ta wound contraction. So bizasaba igihe kugira ngo ahazazamuka hareshe n'ahandi. But at least inkovu ntibikigaragara ushaka kubona ko hitse gusa. So this was a diagram. So going to clinical reality, so uyu ni umuntu babaze ku ruhu rw'ukuboko, so urabona igisebo ko kimeze bisa naho byatangiye guterana, indodo maybe bazikuyemo ntiziri kugaragara. kuyidoda inyuma ku rufu ugomba gushyiraho indodo zitashonga, indodo zishonga uzishyiramo imbere hano utazazikuramo, ariko izo ku ruhu nyuma ugomba kuba zidashonga kugira ngo uzazikuremo. Akenshi bazikora ku munsi wa 7 cyangwa uwa 8 bitewe niko babibona. So the healing by secondary intention, urabona ni umuntu wenda yakomeretse ari ikintu kimushwanyuye cyangwa se yabazwe n'umuntu w'umusharirata tazi ibyo arimo. So after days also there will be reepiphelization, ariko izagorana kubera izamara igihe kubera ko the edges imwe yari kure cyane, epithelial edge iyi iri hano n'indi iri hano ni kure. So there will be a wound contraction izaba ari nini kurusha kuri first intention ahangaha kubera ko na dermis hano yari damaged ari nini. So buriyumvikana consequence contraction sinzi aho mubyumva mwayizamo umuntu wahiye nko mu ntege cyangwa hano forearm na arm bihurira imbere hano inkokora. Akenshi consequence ibamo nuko ukuguru cyangwa ukuboko ntikuba kukirambuka burundu. So ibyo nibyo bita contraction, usanga byaragagaye udashobora kurambuka neza, byaragiye muri flexion aho kujya extension ntibe fully done. So this is one of the consequences as we shall see, or complications of poor healing. So uzasanga rero inkovu igaragara icyambere azakira bitinze kandi inkovu ayimarana igihe kinini cyangwa ibe iya burundu. So granulation tissue area kwiriya shusho and so on. So here we can see that there is no longer granulation tissue, but the scar can be seen. So this is the comparison of the healing by first intention and the second intention, as we have seen previously. So I think this diagram is like the one we have seen before. After inflammation, what happens? So inflammation. Okay, so I don't know what happens. Can you see the screen?
Yes.
Okay. Yes. So inflammation takes place or injury. Okay, injury takes place on day 0. Then within a few hours there will be an inflammation in the blue. Inflammation, but you see that after 80 hours or 0.3 days, it means 8 hours, there is a granulation tissue which starts. A granulation tissue is a component of the healing. It starts. So meaning that here we have in day 1 up to day 3, start of day 3, we have ongoing inflammation overlapping with an ongoing healing because of the granulation tissue. So then from day 3, we will have a collagen accumulation and the remodeling, which will start and they progress. You see that even at day 30, the wound contraction is done, but the remodeling continues. So the fibrosis and the scarring, it takes weeks, months, and even years. It depends on many things. So some people, they use the scar and the fibrosis interchangeably, meaning that they can use either term, they are almost the same. So why does a scar appear? So if, for example, there is a persistent stimulus in chronic inflammation, no kuvuga umuntu afite hepatitis A, B or C, ntabwo yavuwe. So kuba wahagarika inflammation ukoresheje ibinini by'imiti birashoboka, ariko if the stimulus or the injurious agent is still there, the inflammation will go on. So if there is a persistent stimulus, the scarring will take place. So with that persistent stimulus, there will be activation of macrophages and lymphocytes. They will then release the growth factors. This is platelet-derived growth factor, fibroblast growth factor, transforming growth factor beta. This will trigger the proliferation of fibroblasts. Fibroblasts twabonye ko arizo zikora collagen, then izo collagen nizo zikora fibrosis. Also proliferation of endothelial cells because of protein-derived growth factor, which will cause new blood vessel formation, and so on. So other cytokines such as human necrosis factor, interleukin-1, interleukin-4, and 13, they will also accelerate the increased collagen synthesis. So ahangaha mbere hari kwiyongera kwa fibroblasts, hakaza haniyongera nanone ko haje n'andi mateko za fibroblasts gukora collagen. Then there is decreased metalloproteinase activity. So this is an enzyme, metalloproteinase. Proteinase, it means it destroys proteins. So these enzymes are important. Nizo zituma iyo habaye collagen nyinshi zigabanya bitewe no kuzishwanyaguza, because they are proteins, they lyse proteins, they degrade the proteins. So if then there is no enough activity of this enzyme, there will be a decreased collagen degradation. So collagen deposition will be much higher, and all this will cause the fibrosis. So scar remodeling, the replacement of organization tissue with a scar involves changes in the composition of the extracellular matrix. Do not read on this. But here are the mechanisms, 4 mechanisms. Regulation of synthesis by growth factor and the cytokines, the ones we saw on the previous slides. Inhibition of synthesis by corticosteroids. So these corticosteroids, they inhibit the formation of collagen fibers. So other things are regulation of the activation of the secreted but inactive precursors and blockage of the enzymes by specific tissue inhibitors of metalloproteinases. So nukuvuga hari enzymes zirwanya izi metalloproteinases. So izo zigomba guhagarikwa kugira ngo metalloproteinases ikora akazi kayo ko kugabanya za collagen. So murabona ko remodeling y'ubwayo ijyanye no kugabanya ubunini bwa sukari muri rusange. Niki shaka kuvuga. So hakoreshejwe these 4 mechanisms. So here they are showing them. So ngira ngo corticosteroid ambigarso niyo mpamvu uzamubona umuntu ufite sukari nini bamutera imiti ya corticosteroids nka prednisolone kayimutera muri sukari kugira ngo igabanuke, kandi wowe uyimutera. So when I was working in the district hospitals, what we used to do, kwa ko sukari bikomeye cyane, hari pomade twamwandikiraga yakora massage mu gihe cy'iminsi 60. Iminsi 60 yashira ya sukari bayorohereye none ishobora kwinjiramo agashinge. So agashinge impamvu nako kaba kwitonderwa, ugatera munsi y'uruhu, ntabwo ari winjira imbere muri soft tissues, it is subcutaneous. So wamuteragamo corticoids kikagenda kigabanuka n'isi zata ugasanga ni sukari ye imeze nk'iy'abandi. So surgery cannot be done in these cases. Why? Kubera ko ibintu byo kugira sukari nini hazamo ikintu kimeze nka uko umuntu ateye genetique. Agize igisukari kinini ukakibaga ngo uri kukigabanya, noneho haza iki kiruta, kubera ko whenever uwo muntu agize agakovu kiba kinini cyane. So that's why surgery is not indicated in such cases. We must use a medical treatment rather than surgical treatment. So wound strength, they say that in 1 week, wound strength will be 10% of the unwounded skin. So they call it Walker law. So nukuva ni umukore umuntu cesarean section cyangwa umubaza kunda for any reason, ugomba kumenya ko imbaraga niba yarashaka gutera ikintu cy'ibiro 50 ku munsi wa mbere atarabaga, ku munsi wa 10 amaze kubaga nuba ko yatera ikintu cy'ibiro 5. But it is just a comparison. So this means that ntabwo abaragira imbaraga. Niyo mpamvu ibi byose bagenda babara kwa kundi babati mu hydropomedical. So azaruhuka, mwaganga mwandike ko azaruhuka iminsi wenda 14, akagaruka bakongera bakareba niba noneho yasubira mu kazi. So ibi byose baba babibaza. So by 3 to 4 months, wound strength is about 80% of unwounded skin. So birumvikana to reach 100%, it takes time, and sometimes you don't reach that 100%. Mpamvu umuntu wabazwe major surgery akenshi nawe ubwe akenshi yifata nk'umuntu wamugaye, kandi ku ruhande rumwe wanabyumva hari imirimo batashobora gukora if he or she underwent a major surgery such as abdominal surgery. So what are the factors affecting the wound healing? As a medical doctor, what will you say to a patient after surgery? Uzambwira uzarya iki, uzitwara gute kugira ngo igisebe cyawe gikire vuba? So they are listed here. So systemic it means the things which are general to the whole body. Inadequate blood supply. This is an issue. If the blood doesn't reach there, it means nutrients don't reach there, oxygen doesn't reach there adequately. So it can be nutritional. Umuntu udafite indyo ihagije nka proteine cyangwa se ntabona vitamine C, zinc cyangwa se umuntu ugira anemia muri rusange. So uko ari nutrition, ishobora no kuba nutrition cyangwa ntibe nutritional. Nutritional kuvuga uburyo ibiryo bitarimo iron cyangwa se folic acid and so on. There are systemic diseases such as diabetes, nabivuzeho ni imwe mu bintu bituma igisebe kidakira. Arteriosclerosis, I had mentioned atherosclerosis. Renal failure, kidneys are not working properly, or they have failed to work. Infections, systemic infection, umuntu ufite HIV, for example, it weakens the immunity in general. Obesity. So there is also corticosteroid treatment. Why? Ubundi iyo umuhaye umuntu corticosteroids zazindi twavuze zigabanya fibrosis, zifite n'indi consequences, zimanura immunity y'umuntu, zishyira hasi. Atari tubona dufite hari igihe tugira abarwayi cancer yitwa lymphoma, it arises from lymphocytes. Kubera ko umurwayi wa kanseri ashobora kwicwa n'ibintu byinshi, hari n'igihe immunity ye irwana cyane, mu kurwana cyane kangiza n'ibindi. So aba barwayi yarembye cyane ukamuha corticosteroids, ejo ubona ameze neza kubera ko zigabanya ya ntambara yari ihari. Si uko indwara iba yagabanutse, ahubwo uburyo umubiri warwanaga ugateza izindi dega bihita bigabanuka. So corticosteroids, they decrease the immunity. The age, birumvikana ntabwo healing of a child n'umuntu ukuze ntabwo ari kimwe. Umuntu ukuze agize fracture of bone kugira ngo izaterane bitwara igihe kinini, but for a child just in a few weeks uzamubona ari kwirukanka. So immune status nayo yavuze, cancer yamugeze kure, immunity iba yamaze gutsindwa burundu, uwo ngo ntibe gishoboye n'ibisebe afite ntibigira. So there are local factors. Inadequate blood supply ku gace kamwe k'umubiri, twavuga umubiri ni general nk'ufite shock cyangwa anemia. So nk'ahantu hatagera amaraso neza. Presence of foreign body material, okay, bya bindi yo kubaga ugatama ibintu. Mechanical factors, excessive movement, ugasanga arakoresha ahantu cyangwa abazwe mu nda, arikanya ari kubaganya, aragira gute, kandi wenda mwamubwiye ugume hamwe kugeza igihe kinini ntabikurikize. Icyo gihe nabwo gukira kw'ibyo. Gusa nanone muvoma ntoya they are preferred. Muvoma ntoya bavuga ko zituma healing yihuta, but not excessive. Hematoma, it means there is a collection of blood somewhere. Apposition ni bya bindi byo kuvuga ngo igihe wamudodaga wagiye uhuza epidermis to epidermis, dermis to dermis, muscle to muscle. Apposition niba itakozwe ntabwo izakira. Size, location and the type of wound, of course, and the ionizing radiation. Hari wenda umuntu afite kanseri, afite n'igisebe, kanseri bakayivuza radiation bya bitagushiririza, cyangwa murabizi ko mu Rwanda kiri i Kanombe. So aho ngo ntabwo kizakira vuba. So uyu nguyu, it is just a microscopic picture. Harimo giant cells as foreign body, kubera ko hasigayemo uduce tw'indodo. Hari uduce dutinda gushonga birashoboka rimwe na rimwe kuko imbere wakoresheje ibishonga. So because of the suture material. So complications. So we are about to end. So the complications of wound healing, we have deficient scar formation. Igihe scar itakozwe haba wound dehiscence, nko kuvuga gushwanyuka kw'ahantu. Bijya bibaho ukadoda umuntu wamaze mu nda ubundi bigashwanyuka ugasanga amara n'ibifu byagiye hanze. So it is one of the complication. Another one is the ulceration. So icyo gihe ni deficient. So excessive scar formation harimo ya keloid nago umyevuga kibyimba kovu kinini. Exuberant granulation, it is almost the same as the keloid, bitandukanira zuga kuri history yadawize ku maso isanzwe ntago ubitandukanye. Desmoid ikunda kuba cyane cyane ku badamu babazwe mu nda, turabibona bakunda kugira ikitwa desmoid, gasanga yarabazwe nyuma y'imyaka 2 akagira a tumor aho yabazwe. Ituma ikunda kwitwara nka cancer somewhere is semi malignant, so is semi cancer, not a full cancer. So ikibazo cya nyine birumvikana iyo uyibaze ugomba gukora ku buryo ishiramo, otherwise bishobora kumwica. Ariko indi possible complication nuko n'undi n'umuhaga bwa kabiri azongera agira indi kera, ariko ntabwo bareka kuyibaga kuko risk yo kugira indi ntabwo ari 100%. So contraction bamwe bahiye cyane cyane natanze turabona amashusho. So this is a dehiscence, hananiwe guterana agashwanyuka rimwe na rimwe kongera ukadoda bikanga. So this they can complicate into hernia, fistula, eventuation and evisceration. So hernia biterwa n'icyari cyo hernia muzabona nk'umuntu afite intestine zikamanuka zikinjira muri scrotum byita hernia, cyangwa se zikaza zikinjira muri umbilicus ahantu bagira umukondo munini cyane, intestine zajemo ibyo byita hernia. Cyangwa yabaye accident igifu kikazamuka gikurikiye esophagus kikajya hejuru muri thorax kiruhande y'umutima, ibyo nabyo byita hernia. So birumvikana bitewe na organe, hari organe ishobora kuza ikavaho yariri ikinjira hane itagomba kugera. So fistula for example, you have done a surgery on a urinary bladder, but there is an infection. That infection there, kubera ko urinary bladder iryamye kuri uterus, it can also expand and affect the uterus. Icyo gihe bizahinda bite nuko ni hazaho perforation of the uterus and of course the perforation of the urinary bladder. Urine izajya igera muri urinary bladder ye kunyura hanyuraga ikomeza ijya muri uterus. So fistula ngira ngo ni ibintu bizwi and so on. Ko hari n'abagira fistula yindi yabazwe muri anus, then stools ntizige zisonyuraho zigomba kunyura zikanyura ku ruhande ugasanga harantu hiremye indi anus. So that is also. So eventuation and evisceration bitandukaniye he? Hariya harashwanyuka. Iyo hashwanyutse inyama zo mu nda zikagaragara hanze babyita evisceration. Ariko iyo inyama zazamutse ariko zikahera munsi y'uruhu gusa ibyo bita eventuation. So they are almost the same, ariko kuri kimwe zijya hanze, ikindi zikaguma imbere muri pediments ariko zarenze masozi. So ni kimwe no kuziba zasohotse mu nda, ntabwo ziba ziri safe. So here we have an example of keloids. So you do surgery on them, hazaza ibi nini kurusha. So that's why medical treatment is indicated with corticoids. So hari cirrhosis of the liver. Urabona hariho ubuntu bw'umukara bumeze yabaye nk'igikatsi, abaze igikatsi. So niko umwijima umeze wa cirrhosis, kandi ubundi umwijima bari organe iri smooth, which is not hard, ariko cirrhosis biba biri hard, and so abantu bayirwaye usanga bafite ibibazo byinshi bya akenshi it progress to liver cancer, ariko ashobora no kutageraho ngo kubera ko uyu muntu ntabwo aba agikora albumine. Iyo albumine ibuze tuzabona muri hemodynamic changes, the consequence nuko blood pressure igabanuka, then icyo gihe amazi yagiye hanze ya blood vessel ntasubira mu mutima, ahubwo aguma hanze. Niyo mpamvu abantu baba ufite amazi yuzuye mu nda iyo bita ascites, abanyarwanda ndakubyita urushwima. Hari abitiranya cirrhosis n'urushwima, ariko undi cirrhosis uyifite wese agera urushwima. Urushwima ni ariya amazi yuzuye mu nda, ariko amazi yuzuye mu nda ashobora kuzanwa n'ikindi kitari liver cirrhosis. So wound dehiscence here, hananiwe guterana imbere y'ugutwi, ulceration here, keloids and contracture. Umuntu wahiye uyu ntabwo ashobora kurambura akagatoki, this finger ngira ngo naka gahera ke nako ntabwo ashobora kurambuka. This is contracture. Umuntu wahiye bikunda kubaho. So in summary, the wound results in bleeding. Turi kuvuga nka process uko bigenda. So when there is a wound, there is a bleeding. So there is a temporary closure of the bleeding, beta hemostasis, as we saw when we started. So there are mediators which are generated by necrosis at the edge of the wound. These mediators lead to exudation, which helps also to dilute dangerous agent and the cleaning of the wound bed. There is a chemotaxis attraction, the chemicals which attract cells, and then there is a clearing of the necrosis. Then there will be proliferation signals. Thrombocyte and histiocyte generate growth factors that we saw for fibrosis and endothelial cells. Then we'll have a granulation tissue, because granulation tissue refers to deposit of collagen and formation of new blood vessels, capillaries. Then there will be a scar tissue which will form with much collagen deposit. And after that, you remember this scar must be remodeled to get enough strength and to make sure it doesn't exceed what is needed. So definitive remodeled closure of the wound. So this we have seen injury. It can be the healing can be by regeneration, by repair, with scar formation, or by fibrosis. You remember we saw this when we started. So thank you very much. Any question?
Question.
Yes.
Lecturer, like on the last slide, the woman who had the wound dehiscence, and what do they do for her?
Yeah, the first thing in medicine is to know the cause. The cause. Always medical doctors, you must treat the cause, not just what you see. Of course, in some scenarios, you start by treating the symptoms. Tuvuge umuntu niba aje afite umuriro ukavuga ngo reka ngo ibinini by'umuriro ugende, icyo ntabwo ari igisubizo. Uramufashije ako kanya, ariko this is not a etiological treatment. So the same here, the essence ugomba kumenya icyayiteye ni iki. Akenshi haba hajemo infection. So iyo hajemo infection rero icyo ukora ni iki? Ntabwo wavuga ngo reka ngo mpfe gufunga ngo nzamuha antibiotics, kuko byanze kunze birongera bigashwanyuka. Ahubwo nibwo uzasanga rimwe na kwa muganga hari umuntu ubaho inda ye ifunguye, because they are treating the infection until the infection is healed, then they will close. So niba wamenye ko ari yatewe n'ikintu runaka, hari research nyinshi zikorwa, hari n'iri gukorwa surgical site infection, bakamenya ubundi ni izihe bagiteri zazabiteye, kuko dufite n'ikibazo bagiteri nyinshi ziri resistant ku miti ihari. So ugasanga wenda mbere niga undergraduate kenshi bakoreshaga imiti nka ampicillin and gentamicin, niyo miti yari standard ku muntu wese wabazo, ariko ubu ntikora. Ntushobora kuyitera umuntu ngo areke kugira infection. So icyo rero bisaba iki? Niba agize dehiscence uzaba ati byanze kunzana infection, ni ugufataho sample bakayijyana muri microbiology, bagakora culture. Bamara gukora culture bakabona bacteria zayiteye ni izihe, icyo gihe ziri bazishyize mu kintu gituma zibyara vuba vuba kugira ngo zibashe kuba detectable muri test. Otherwise ufashe gutyo ugahita upima nta bagiteri ubona, ahubwo ubidu culture then the bacteria will grow, then you can identify which bacteria. Iyo birangiye, iyo maze gukura, bakora ibyo bita sensitivity test. Ni ukuvuga hari kugira ngo mwabonye muri microbiology cyangwa muzayibona, hari uduplate baba bafite harimo ibintu byabigenewe za bagiteri zishobora gukuriramo, n'ubundi handi bazihinze akenshi niho ukoresha. Icyo rero uragenda ukarambikamo ibinini bitandukanye, ntabwo ari ibinini nk'ibyo waha umurwayi, ariko niba ari ikinini cya amoxicilline, niba ari icya cefotaxime, ni icyagenewe iyo test, ariko the same, it has the same property nk'ibyo waha umurwayi. So ukirambikamo gusa, then ukareba, ukagenda ureba nyuma y'amasaha 6, nyuma y'iminsi 2, ukareba ni ikihe kinini ahakizengurutse bagiteri zose zapfuye. So niho baza kuvuga ngo bari gukora antibiogramme mu Gifaransa, cyangwa niba antibiotic sensitivity test cyangwa niko yita mu Cyongereza. So icyo gihe uzabonye icyabiteye, noneho uvuga wa murwayi impamvu ya dehiscence nuko yatewe na bagiteri yitwa wenda let's say Klebsiella. Then kandi muri microbiology bambwiye ko babonye sensitive gusa wenda kuri imipenem. Then you prescribe imipenem, ariko ahangaho uzirinda icyo gihe kuhafunga infection itaravamo, kuko ntacyo uzabikora. So uzaba usanga rero hari abantu bafite inda ifunguye mu bitaro, akenshi nyine bajya muri stress intensive cyangwa ahandi badashobora kwanduzwa n'abantu bavuye hanze. Then until the infection is gone, then surgery igakorwa. So there is no day around. Ibyo gusa ntibibuza ko buri munsi bamukora desinfection kugira ngo bice nabyita physically za bacteria izigaragara inyuma, ariko ari ziba zirimo imbere aho iramiti bogesha itagera. So you combine these antiseptic measures with a proper antibiotic treatment, which is evidence based. Atari gupfa kuvuga ngo reka dupime tume chlorhexidine cyangwa amoxicilline, no. So ibyo ntabwo ari ibintu byagombye kuba bigikorwa ubu ngubu, nubwo bikorwa birumvikana. Ibyo ni kuvuga bikorwa mu bitaro biteye imbere, ntabwo ari ibitaro byose bikora ibyo ngibyo. Teaching hospitals many and some few other hospitals. So are you satisfied?
Okay, thank you.
Welcome.
Yeah, I'm satisfied. Ariko se haramutse haboze ubwo bizagenda gute?
Sorry?
Haboze ntago nyine
Haboze
ndabona hari like kuko
nibyo twavugaga, kubora nyine haba haboze. Iyo habaye dehiscence haba haboze, ahubwo keretse ubuti bikomeje bo ntabwo byakomeza, keretse ibyo bidashoboka. Ibyo gupima antibiotic zamuvura niyo role y'abaganga bize microbiology. Unfortunately mu Rwanda dusa naho ntabo dufite, ni bake cyane bahari ubu ngubu. N'abahabenda bafite izindi responsibilities, kuvura hafi buri munsi ntibishoboka, ariko nibo bagomba gukora icyo ngicyo. Byangwa hari twaganiraga ubushize mbwira ikibazo kiri mu bitaro ko imiti yose bako ari itakiri sensitive ku amabacteri menshi hano atakiri sensitive, bizagenda bite? Arambwira ariko ni ikibazo cy'imyumvire rimwe na rimwe. Yarambwiye ati ubundi tugomba kugira strategy, imiti twakoreshaga tuve nk'ubu niba ari gukoresha penicilline zigezweho cyane, zimwe ku isi yose zigezweho, mu gihe tuzikoresha ni byiza ko zishobora amabacteri menshi, ariko bagiteri zigiye nabo zikazimenyera ntizibe zikira, ibyo bita resistance. Ati icyo gihe rero ubundi uko twagombye kuyenza, hari imiti ya kera yaretswe. Ya miti ya kera yaretswe, bagiteri za kera zagezeho resistance, iyo miti tugomba kuyibika tukayiproteja kugira ngo dukoreshe igezweho ninanirwa tuzasubira kwayindi. Yampaga urugero umuti witwa bacterium twabuvurishaga kera neza 2007 n'8 ntangira akazi, twawuvurisha ugakora, ariko mu minsi yashize completely warananiwe kuvura infection iyo ariyo yose. Ariyo none yarambwiye ati ubu ni uri gushobora za bagiteri z'ibihanganye zose zananiwe n'imiti ikomeye ku isi. Aho kandi ni hano mu Rwanda. So hagomba kubaho strategy yo kurinda iyo miti antibiotics. Ubundi ikibazo kiri hangana no buri wese agira access, ariko iyo urebye muri Europe gufata umuti wa antibiotics ni kimwe no gufata imiti ya cancer cyangwa nk'igisasu. Ntabwo ushobora kuwufata cyangwa kuwubona. niyo tuyikoresha muri test muri za labs, uburyo you discard things you have used with antibiotics bazijyana nk'aho ari ibintu bira bya energy nucleaire, babijyana mu rwego rumwe. So bo baba birinda iki resistance, kuko nk'ubu haramutse hari nk'igihugu cy'umwanzi kikaza kigafata bagiteri zifite resistance ku miti ihari kikazitera nko mu gihugu runaka, icyo gihugu kiba kimeze nk'igitewemo igisasu, kuko kugira ngo abantu bazarwara bazakire keretse ari igitangaza. So hano rero ntabwo tuziproteja, usanga farumasi ziha umuntu nta test yakorewe, rimwe na rimwe n'amabutike akazicuruza. So it is a problem. So soon you will be the managers of health care systems. So you just you must keep in mind, niba twe twarananiwe, but you will have to cope with these things.
Yes,
So
thank you.
okay, welcome. So otherwise kubora haba haboze, ariko wenda ikindi nasubiza nuko iyo igice kinini cy'umubiri cyangiritse gutya habaho kugisimbuza, nibyo bita plastic surgery. So plastic surgery ni ukuvuga kugerageza gusimbuza igice cyatakaye kitashobora gusimbuzwa ukundi, bagisimbuza ikindi kintu. So haraba it is a subspeciality, abiga surgery havamo abajya gukora subspecialization muri plastic surgery. Ya mu Rwanda ntabwo dufite benshi, wenda ni 2 cyangwa 3. Hari uri sash katwiganye i Butare, so we ariko azobere gukora plastic surgery mu bantu bagize kanseri y'ibere bakarikuraho agakare ikindi kintu kimeze nk'ari, ariko hari n'abandi bakareye ibindi byo ku ruhu and so on. But ni basically muzamubona naho ku bitaro CHUB n'ahandi, hari igihe umuntu aba afite nk'igisebe kinini cyane bakaba bati ntabwo hazakira. So what to do? Hari utwuma bakoresha bagakura uruhu ahandi hantu nko ku kibero, bafite uburyo barutwara bakagenda bakagomeka ahandi. Iyo hashize ibyumweru bingahe cya gisebe cyakize n'ahandi barukuye, ko bakuraho epidermis, urebye ni epidermis gusa, nta gisebe kinini kiba gihari, cyo gihita gikira. So it is like a kind of plastic surgery ko ikorwa n'abaganga bari bose muri surgery. So twiga Butare barabikoraga. So ni ukuvuga iyo ari ikintu kinini nk'iki wenda kidashobora guterana ubwacyo, hari ubundi buryo mechanism yo gukoresha plastic surgery gusa. But this is a very expensive procedure. So plastic surgeon ashobora kubaga kuva saa moya za mu gitondo akagera saa 4 y'ijoro ku muntu umwe wenyine. So biravuna, birahenda, byagombye guhenda na nuko leta y'u Rwanda igerageza gufasha abaturage, otherwise hakurikijwe byagiye nta n'umuntu ashobora kubyishyura. So leta ikora subvention. So it is not, I think wavuga ngo ni ikintu kiri zakorwa routine, nta kibazo burabaza ngo plastic surgery, no. It is very expensive, it's time consuming. Niyo mpamvu tugomba kugerageza ibindi bishoboka byose. Further questions? So then we break. When we restart, resume at 2. Okay, I need the answer from the representative. So anybody to reply? Okay, so we resume at 2 p.m. using the same link. I hope it will work. So enjoy your lunch. Okay, someone asked to share the slides. I don't see where I can attach a document. Maybe I will send it to the email of your representative. Unless someone tells me and direct me on how to attach a document here. Okay.